trauma radio crackled at 11:47 p.m., and every doctor in the ER stopped breathing. Clearance requested for Cascade Ridge Medical Center. We have 3 critical inbounds, and we are specifically requesting Nurse Voss. Repeat, Nurse Lena Voss only. The room went dead silent, because Lena Voss was standing 6 feet away, filling out discharge paperwork in worn scrubs, no title on her badge, no authority in her job description. Just the woman the senior residents called the ghost because she barely spoke and somehow never got promoted. Dr. Raymond Breck turned and looked at her like he'd never seen her before. Maybe he hadn't. Before this story goes any further, if you've never watched one of our videos before, right now is the time to hit that subscribe button and turn on notifications, because the story you're about to hear is the kind that will keep you wide awake until the very last word. Drop a comment below and tell me what city or country you're watching from. I want to see exactly how far this story has traveled, and if it grabs you, hit that like button. It means more than you know. Now, let's go back to the beginning, because to understand what happened in that emergency room, you have to understand who Lena Voss really was, and why nobody at Cascade Ridge ever bothered to find out. The first thing most people noticed about Lena Voss was that she didn't perform. In a hospital like Cascade Ridge Medical Center, a mid-sized regional trauma facility in the working-class edge of Delmore, Oregon, the kind of place that ran on short staffing and shorter tempers, most people performed constantly. The attendings performed confidence for the residents. The residents performed competence for the attendings. The charge nurses performed authority for everyone beneath them. Even the orderlies had a way of moving through the halls that said, "I belong here. Don't question me." Lena didn't do any of that. She arrived at the start of her shift, changed into plain navy scrubs, clipped her badge to her chest pocket, and moved. That was it. No small talk at the nursing station, no coffee cup with her name written in marker, no complaints about the schedule posted on the break room wall, even when her name kept appearing on overnight rotations that nobody else wanted. She was 34 years old and had been at Cascade Ridge for 11 months. In those 11 months, she had never been late, never called out sick, and had been written up exactly once for allegedly undermining physician authority when she flagged a medication dosage discrepancy that turned out to be a near-fatal error. The attending who ordered it, Dr. Raymond Breck, had written the report himself. The pharmacy confirmed Lena was correct 3 days later. Nobody amended the write-up. That was the kind of place Cascade Ridge was. Breck was 47, broad-shouldered, the kind of man who filled a room not because he was especially tall, but because he moved like he expected furniture to get out of his way. He'd been chief of emergency medicine for 6 years and had a reputation for 2 things: fast diagnoses and a very short memory for being wrong. His residents respected him the way people respect something that can hurt them. His nurses mostly avoided his orbit when possible. Lena didn't avoid him. She just didn't engage him more than necessary, which he had, over time, interpreted as either incompetence or arrogance. He hadn't decided which. "Voss?" he said one Tuesday afternoon in October, 2 weeks before everything broke open. He was standing at the central station reviewing chart notes, not looking at her. "You documented a patient complaint for room 7 without running it through the charge first." Lena was restocking the supply cart beside him. She didn't stop what she was doing. Mrs. Fournier was describing chest tightness that started after her contrast infusion. I documented what she told me and flagged it on the system. "She has documented anxiety disorder." "She does." This wasn't anxiety. Breck looked up from the chart. The way he looked at her was specific. Not quite contempt, but something adjacent to it. The look a person gives a thing they've already categorized and filed away. "You ran an EKG without an order." Her oxygen saturation dropped 2 points while I was in the room. I used clinical judgment. "You're a floor nurse, Voss. Clinical judgment is a physician's—" The EKG showed ST changes. She said it simply, without edge, without apology. Just fact. "Cardiology came down 20 minutes later. She's upstairs now." Breck didn't answer. He looked at the chart again. Around them, the station had gone very quiet. 2 residents pretending to type, a charge nurse named Dolores pretending to sort papers. Everyone listening and everyone making sure it didn't look like they were. Don't run orders you don't have, Breck said finally. He walked away. Dolores waited until he was through the double doors before she exhaled and looked at Lena. Dolores was 51, 15 years at Cascade Ridge. The kind of nurse who had survived enough administrations that she'd stopped caring what any individual doctor thought of her. She liked Lena in the quiet way that people like someone they can't quite figure out. "You know he's going to make your life harder," Dolores said. "He already does." Lena finished counting the IV supplies and moved the cart back against the wall. "Mrs. Fournier is still alive. That's the part that matters." Dolores watched her go. "That's the part that matters," she repeated to herself under her breath, in a tone that was equal parts admiration and exhaustion. The rumors about Lena were various and contradictory, which was usually how it went with people who didn't explain themselves. The most common version, the one that circulated among the first-year residents and some of the nursing staff who didn't know her well, was that she'd been let go from her last hospital for insubordination. Somebody said it had been a hospital in the Pacific Northwest. Somebody else said it had been 2 hospitals. The story mutated the way idle stories do in closed institutions, a small, unverified seed growing into a structure that people found more interesting than the truth. A second-year resident named Kobe Marsh, who had a talent for gossip and an equally notable talent for being wrong, had told 3 separate people that Lena had a psychiatric history. He said it with the casualness of someone reporting established fact. He had no source for this. He had overheard Dr. Breck once say that Lena was not quite right, meaning her clinical approach, meaning her habit of flagging things before monitors caught them. And Kobe had translated that through whatever filter he ran perceptions through and arrived at a conclusion that said more about him than it did about her. The third story, whispered rather than stated outright, passed between people who watched her more carefully, was different in character. It had started with a nurse named Petra Osman, who had done 2 years of EMT work in a combat zone before coming back stateside and eventually landing at Cascade Ridge. Petra didn't talk much about that time. She recognized a quality in Lena that she couldn't name specifically, but felt with the precise accuracy of someone who had seen it somewhere before. The way Lena moved in a crisis was the thing. It wasn't that she moved fast. She moved organized. There was a sequence to her, a hierarchy of priority that wasn't textbook nursing protocol and wasn't quite emergency medicine either. It was something that looked like it had been trained into the body rather than the brain. "She scans rooms," Petra had told Dolores once, in the break room during a quiet stretch of night shift. "Every time she enters a patient area, she checks the exits. She checks the faces." Dolores had stirred her coffee. "Maybe she's just observant." "I used to do the same thing," Petra said. "After Kandahar, for 2 years, I couldn't stop doing it." She paused. "I don't do it anymore." She still does. Dolores hadn't said anything, but she'd started watching Lena more carefully after that. 3 nights before the helicopter call, Lena was working a double, a regular Thursday overnight into Friday morning, the kind of shift that ground down most people by the 5-hour mark. At 2 a.m., a man named Gerald Okafor came through the ER entrance on foot, no ambulance, accompanied by a woman who was presumably his wife, both of them moving with the specific controlled panic of people who had been arguing about whether to come to the hospital for the last hour, and had finally lost that argument. Gerald was 62. He sat down in the intake chair and said his stomach hurt. He said it the way men of a certain generation describe serious pain, flatly, minimizing, as if admitting scale would be a kind of weakness. The intake nurse, a young man named Darren, logged his vitals and wrote abdominal discomfort, possible GI issue in the initial notes. Breck's resident, a 3rd-year named Simone Peretti, who was good but tired, ordered a basic metabolic panel and told them someone would be with them shortly. Lena walked past the intake area 40 minutes later on her way back from restocking the medication room. She slowed. Gerald Okafor was sitting very still, too still. His wife was talking to him quietly, and his answers were getting shorter. His skin tone had a grayish pull to it that didn't belong to the overhead lighting. Lena had seen that color before, in places she didn't talk about, and she knew what it usually preceded. She changed direction. She pulled a blood pressure cuff and pulse ox from the mobile cart beside his chair and asked if she could check his vitals. He nodded. His wife looked relieved that someone was paying attention. His systolic pressure was 88/52. His heart rate was 112 and climbing. Lena straightened up and walked directly to the nurse's station and found Simone. The man in intake, Gerald Okafor. His pressure is in the basement and he's tachycardic. I think he's bleeding internally. Simone looked up from her notes. He came in for stomach pain. I know what he came in for. Something in Lena's voice, not loudness, not urgency exactly, but a kind of flat certainty, made Simone stop. She looked at her for 1 second and then stood up. They moved Gerald to a trauma bay within 4 minutes. His pressure continued to drop. CT imaging expedited showed a ruptured abdominal aortic aneurysm. He was in surgery 40 minutes after Lena had changed direction in that hallway. The vascular surgeon who operated on him told the team the next morning that Gerald had probably had 90 minutes, maybe less, before the rupture would have been unsurvivable. Lena wasn't in the debrief. She had gone home at the end of her shift and was asleep before the morning report began. Breck heard about it third hand from Simone, who told it without meaning it as praise, just as a clinical account of what had happened. But somewhere in the telling, the sequence of events was clear. His resident had been tired and had missed it. His nurse had not. He didn't say anything about it. But something shifted slightly in how he watched her after that. Not enough, but slightly. The incident that broke the surface happened on a Saturday afternoon. A man came in through the ambulance bay. Combative, disoriented, restrained on the gurney. He'd been found in a parking lot, unclear history, unclear substances. He was large, well over 200 pounds, and it had taken 2 paramedics and 1 EMT to manage him in the truck. In the trauma bay, he pulled one wrist free of the soft restraint and sat up swinging. It was chaos for approximately 4 seconds. 3 people stepped back. 1 resident hit the crash cart trying to move. A tech ducked. Breck, who had been in the doorway, did nothing immediately. Not because he was a coward, but because the geometry of the room had shifted and there wasn't a clean line to the patient from where he stood. Lena was at the medication tray. She turned, assessed the room in one look, set down the syringe she was holding, carefully, not dropping it, and moved to the patient's right side in a path that threaded between 2 staff members without touching either of them. What she did next was over in roughly 3 seconds. Her left hand found his wrist, the one that was swinging, and redirected it downward with something that looked almost like gentleness if you weren't watching closely. Her right hand came across his upper body and applied pressure to a point on his shoulder that caused him to immediately and involuntarily lean back against the gurney. She said 2 words to him, "Stop, down," quietly, in a tone that had no anger in it, only a kind of absolute authority. He lay down. It wasn't sedation, it wasn't luck, it was a technique. The room was silent for 3 full seconds afterward. Breck was staring. His mouth was slightly open, which was not an expression his face was accustomed to making. Petra Osman was across the room and had watched the whole thing with very still eyes. She looked at Lena the way you look at someone when a suspicion you've been carrying for months has just been confirmed. Lena reached back, picked up the syringe she had set down, and resumed preparing the medication. "Someone get the restraint back on," she said. Darren, the intake nurse, fumbled forward and did it. The moment passed. The trauma bay reorganized. The patient was sedated and assessed. Everything proceeded. But in the hallway afterward, Breck caught Petra's arm as she was walking out. "Where did she learn that?" he said. He didn't use Lena's name, but they both knew who he meant. Petra looked at him for a moment. "I have no idea," she said, which was the truth. She had an idea about the category, but not the specifics. Breck let go of her arm. He stood in the hallway for a moment after she walked away. The shift continued. He didn't bring it up. He didn't ask Lena anything. But something was sitting at the back of his mind now, taking up space he wasn't sure what to do with. On Thursday evening, 2 days before the helicopter landed, hospital administration delivered a memo to the nursing staff. Lena received hers in her locker. She read it in less than 60 seconds. The subject line was, Staffing Restructure, effective November 30th. The body of the memo, written in the careful language of institutional bureaucracy, explained that Cascade Ridge was undergoing a performance-based staffing review and that certain positions were being realigned, nurses below a satisfactory threshold on the new performance metrics, a rubric that had not existed 6 months ago and that weighted, among other things, physician feedback scores and team integration assessments, would be placed on probationary status. Lena read the section that applied to her twice. Her physician feedback scores were the lowest in the department. This was not surprising. Her team integration assessment, as scored by Breck and 2 of his senior residents, described her as resistant to collaborative protocols and difficult to direct. She put the memo back in her locker and went to her shift. She didn't tell anyone about it. She didn't look upset. She picked up a patient chart at the station and started reading it the way she always started reading charts, from the medication list first, then the history, then the notes, because that was the sequence that caught the most errors fastest. Dolores saw her come in. Dolores had also received a memo, but hers was different. Her scores were fine. She watched Lena settle into her shift and thought about saying something and didn't, because Lena had the quality of a person who had already processed a thing and moved past it, and interrupting that process felt like the wrong instinct. At 9:30 that night, a pediatric patient in Bay 4 began decompensating. The child was 7 years old, post-surgical, and had been recovering from an appendectomy. The surgery had gone clean. The recovery had been unremarkable. Then, in the space of 20 minutes, something shifted. The monitor showed increasing tachycardia. The child was restless, couldn't settle, kept saying her chest felt funny. The night resident, a capable second-year named Aiden Torres, ordered a repeat CBC and tried to reassure the family. Lena was passing in the hallway. She heard the word chest through the curtain and slowed. She pushed through, introduced herself to the family, and looked at the child. She took the girl's pulse at her wrist. She looked at the neck veins. She looked at her color. "When did she last have her blood pressure checked?" she asked the tech. 20 minutes ago. It was fine." "Check it again." Lena kept her fingers on the child's wrist and counted. The pulse was rapid and thin, not the pulse of a child with anxiety, the pulse of a child whose heart was fighting. The blood pressure came back, 78/44. Aiden came back into the bay. Lena looked at him. "Pericardial effusion," she said. "She needs imaging now." Aiden looked at the monitor. She's post-appendectomy." "How would she say?" "I don't know, but I know what I'm feeling." She kept her tone even, factual, not a challenge, an observation. "Her JVD is elevated, her pressure is tanking, her heart sounds are muffled on the left. This is Beck's triad until something tells me it isn't." Aiden looked at her for a long second. He was young enough that his ego wasn't fully calcified yet. He ordered the echo. The echo showed it. A circumferential effusion pressing on the right ventricle, moderate to large. The kind that built quietly after surgery sometimes, a slow leak of fluid into the pericardial sac, invisible until it wasn't. The cardiologist on call was paged. The attending was paged. The family was moved to the hallway and someone spoke to them in the calm, deliberate voice of a person managing high stakes. In the trauma bay, as the team assembled around the child, Breck arrived. He looked at the echo image. He looked at Lena. "You flagged this?" Torres ordered the echo. "I flagged the presentation." He looked at the image again. "When did you develop this skill set?" "I've seen a lot of presentations." He waited, as if expecting her to say more. She didn't. The child needed a pericardiocentesis, a needle drain of the fluid compressing her heart. The cardiologist would perform it. The team prepared. Lena stood at the medication tray and drew up medications in sequence, calm, efficient, the way she did everything. Breck watched her from across the bay. He was revising something, somewhere in the back of his brain. Not his behavior yet, not his treatment of her, just his model of who she was. And those were very different things. The child stabilized. The drain relieved the pressure. Her blood pressure climbed. Her color came back. Her mother, who had been in the hallway crying into her hands, was brought back in to see her. The shift continued. The clock moved toward midnight. Lena finished her charting at 11:41 p.m., initialed the handoff notes, and was putting on her jacket when the radio at the central station clicked on. A male voice, clipped and practiced, with the cadence of someone accustomed to communicating in high-noise environments. Cascade Ridge Medical, this is Army Aviation Chalk 37, inbound with 3 critical trauma patients, ETA 11 minutes. Be advised, we are specifically requesting Nurse Lena Voss for primary trauma reception. Repeat, Lena Voss. Please confirm her presence. The station went silent. 6 people standing around the central desk, and every single one of them stopped moving. Dolores looked at the radio. Then she looked at the hallway. Lena was still there, jacket half on, badge still clipped, standing 20 feet from the desk. She had heard it. She stood very still just for a moment with the expression of someone who had been expecting a phone call and was deciding whether to answer it. Breck came out of his office. He had heard it too. His face was doing something complicated. He looked at Lena. Voss? She was already pulling her jacket off. She walked back to the desk, picked up the radio handset, and pressed the transmit key. Chalk 37, this is Voss. I'm here. What are you bringing me? The voice on the other end shifted slightly. Not relief exactly, but the specific loosening of someone who has been holding tension and can now release a fraction of it. Commander, we have a crushed thoracic trauma, a TBI with suspected intracranial bleed, and a pediatrics, 7 years old, blunt abdominal trauma, pressure dropping. She's the one we're most worried about. Lena's jaw set. What's her current pressure? 70 systolic and falling. Airway? Maintained, for now. Okay. She looked up at the room, at Breck, at Dolores, at Aiden Torres, who had come in from the hallway. I need trauma 1 and 2 prepped. Type and cross on the pediatric patient. I need 4 units of O negative on standby. I need ultrasound in the room, and I need someone to page vascular and ped surgery right now, not in 5 minutes. Nobody moved for 1 full second. It was Breck who broke it. You heard her? He said to the room. Move. And they moved. They moved because Breck told them to, and that fact alone said something about the night that nobody in that room was ready to examine yet. Dolores was already at the trauma bay phone, paging vascular. Aiden Torres had gone for the ultrasound cart at a pace that wasn't quite running, but was close enough. 2 nurses Lena barely knew by name were pulling supply drawers and snapping gloves onto their hands and asking each other questions in the shorthand of people who had done this before, but not exactly like this. Lena walked to the supply room and pulled her own kit, not the hospital's standard trauma tray, but a secondary bag she kept in the lower cabinet, one she'd stocked herself over the course of 11 months, replacing items as she used them on other patients other nights. Breck saw her pull it and started to say something and then didn't. She came back to Trauma 1 and set the bag on the counter and began laying out instruments in a sequence that was not the hospital's standard sequence. Nobody questioned it. The room had shifted in some way that was hard to name, not because of what Lena had said or done exactly, but because an Army helicopter had called a civilian hospital in Delmore, Oregon, and asked for her by name and rank, and that information was now sitting in the middle of the room like an object everyone could see and nobody had picked up yet. What's her background? Aiden said quietly to Dolores, while Lana was across the room. I don't know, Dolores said. You've worked with her for... I know. Dolores clipped a monitor line with more force than necessary. I don't know. Breck was at the doorway. He'd put on gloves, but hadn't moved further into the room. He was watching Lena organize the bay with the expression of a man rearranging a mental filing system that had just been told it was organized wrong. At 11:54 p.m., the ambulance bay doors opened and the sound of rotor wash came through the walls before the first gurney did. The first patient was a man in his 50s, construction worker based on the clothing remnants still on his body. His name came in with the medic, Daniel Farrow. A steel beam had come down on a work site and caught him across the chest and left arm. His left humerus was fractured in 2 places. 3 ribs were broken, one of which had punctured the pleural cavity. His lung was partially collapsed, and his oxygen saturation had been sitting at 88% for the last 7 minutes. The Army medic who ran in with him, a young woman, mid-20s, short hair, sweat on her collar, was reading vitals off a handheld device and talking at the same time. Tension pneumo on the left. We decompressed in the field. Left-sided chest tube placement incomplete. He pulled the line during transport. What's his pressure? Lena said. 104/60 and dropping. Airway? His own. Saturation's climbing since we started supplemental. Okay. Lena looked at Breck. He needs the chest tube finished. Can you take him? It was not the way nurses spoke to attending physicians at Cascade Ridge. It was not the way anyone spoke to Breck usually. But the sentence came out as a direct operational question. Not defiant, not deferential, just functional. And Breck answered it the same way. Yes, he said. He moved to Pharaoh's gurney. The second patient came through 30 seconds later. A woman, late 30s. Her name was Sandra Obi. She'd been in a vehicle that had been hit by debris from the same worksite collapse, a secondary incident, the medic explained. A chain reaction that had taken out a car on the access road. She had a scalp laceration that had bled heavily and was currently bandaged, a suspected orbital fracture, and a loss of consciousness that had lasted 4 minutes in the field. She was awake now, but slow. Her pupils were unequal. She needs CT and a neurosurge consult, Lena said. She looked at Aiden. Take her. Aiden blinked. I'm a second year. You know what unequal pupils mean. Get her to imaging and get neurosurge on the phone. You don't have to fix this. You have to get it in front of the right people fast. Go. Aiden went. The third gurney came through the door and the room tightened. The child was small. Too small for the gurney, really, the way children always looked wrong on adult equipment. The proportions off. The scale distressing in a way that hit some specific register in the human brain that adult trauma didn't. She was 7 years old, the medic had said. Her name, from what they could read on the field tag, was Margot. She was unconscious. Her color was the color that Lena had learned, in a different country and a different life, to treat as its own kind of alarm. The medic running beside the gurney was the one who had been on the radio. The male voice, older, a staff sergeant, whose name tag read Wikis. He had a quality of controlled urgency that meant he had seen bad things before and was currently seeing something he considered among the worst ones. Blunt abdominal. We think splenic laceration based on mechanism and the belly presentation. Pressure when we loaded was 82. It's been dropping. She had one large bore IV established and it blew during transport. We're running behind on fluids. How long? Lena said. 31 minutes since injury. 31 minutes. The spleen, if it was the spleen, could bleed fast. With a child this size and a pressure that low, fast was already an understatement. I need that IV re-established now, Lena said. She was already moving to the right side of the gurney. Who's my best stick in this room? A brief pause. Dolores pointed at a nurse named Terrence who had followed the gurney in from the bay. Terry is. With me. She looked at Wicks. What's her weight? 22 kilos approximately. Lena was doing math in her head. Fluid, resuscitation, pressor dosing if it came to that, blood product ratios for a pediatric patient. The numbers moved through her in the automatic way of someone who had done this math before. In harder conditions, with worse equipment. Terrence got the IV on the second attempt. He exhaled audibly. Good, Lena said, and meant it. Push a bolus. 10 mils per kilo, normal saline, wide open, and get the O-neg out of the refrigerator. She might be stable enough for... She's not. Lena had her fingers on the child's abdomen, palpating gently but with purpose. She felt what she expected to feel. Involuntary guarding, the muscles beneath her fingers tightened in that specific way that meant the body was protecting something that hurt. Her abdomen is rigid. She's bleeding somewhere in there, and she's been compensating, and she's running out of room to compensate. Get the blood. Terrence got the blood. Wikis was standing at the foot of the gurney. He was watching Lena work with an expression that had shifted from urgency to something quieter. Recognition, maybe. The specific recognition of one trained person watching another trained person, seeing the vocabulary of their own experience reflected back. Your hearts, people? He said. Lena looked up briefly. What? Sorry. I mean, you trained under the same... He stopped himself. He'd said something he hadn't meant to say, or something that assumed a context he hadn't confirmed. Lena looked at him for exactly 1 second. Focus on the patient, she said. He nodded and didn't push it. But Dolores, who was hanging a second bag of saline on the opposite side of the gurney, had heard it. She kept her eyes on the line and didn't look up, but the back of her neck prickled in a way she would remember later. The next 40 minutes were the kind of time that compressed and expanded simultaneously. The particular quality of a trauma situation where individual seconds felt elastic and the overall stretch felt like it had passed in a blink. Breck got the chest tube finished on Farrow. His saturation climbed to 95 and held. The orthopedic resident arrived and began assessing the arm. Farrow was stable enough to hold. Sandra Obi went to CT. The images came back showing a small subdural hematoma, contained, not expanding, but requiring close monitoring and a neurosurgical eye on it. The neurosurgeon on call, a precise and unhurried woman named Dr. Renata Spalding, arrived at 11 minutes past midnight and took the case. Margot was the one Lena didn't leave. The child's pressure stabilized briefly after the blood and fluids, climbed to 86 systolic, then began to slide again. Not dramatically, not the free fall that would have meant the bleeding was catastrophic, but the slow, grinding drift of something that wasn't fixed, just briefly slowed. Pediatric surgery was in the building, but 15 minutes away. The attending, Dr. Hiroshi Mabe, was on the phone with the ER, and his voice through the speaker had the taut patience of a surgeon who was moving as fast as he could and knew it wasn't fast enough. "What's her pressure doing?" he asked. 81 and trending down, Lena said. She had the ultrasound probe on the child's abdomen, doing a bedside fast exam, a focused assessment for blood or fluid in the abdominal cavity. "I've got free fluid in Morrison's pouch. There's significant fluid around the spleen." "How much?" "Enough." She tilted the probe. "Mabe, she's going to need the OR." "I'm 12 minutes out." "I know. I'm telling you so you can call ahead. She needs to go straight from here to the table." A brief silence. "You know how to run a fast?" It wasn't a question. It was the specific tone of a physician recalibrating. "I know how to run a fast," she confirmed, and moved on. Breck had come into the bay at some point, she couldn't have said exactly when, and was standing near the doorway watching. Not interfering, not directing, watching in the way that meant he was paying attention in a different way than he usually paid attention to things. She didn't look at him. She had too much to keep track of. Margot's IV infiltrated. The line went bad, the fluid backing up, the site swelling faintly under the skin. Terrence caught it before Lena had to say anything. He pulled the line and moved to establish a new one, this time going for the external jugular, which on a child took nerve and precision. "You've done EJ on peds before?" Lena asked him. 3 times. "Then do it." She held the child's head in position while he worked, a small, specific thing, the kind of thing that nobody would write in a chart, but that made the procedure possible. Terrence got it on the first pass. His hands were steadier than they had been 30 minutes ago. "Nice," she said. He didn't respond, just moved to tape the line, but his shoulders dropped a fraction. Wickes, the army medic, had not left the room. He was technically unnecessary at this point. The patients were handed over, his role was done. But nobody had told him to go, and he hadn't gone. He was positioned near the supply counter, staying out of the way, watching the choreography of the bay. At 12:23 a.m., the bay's internal phone rang. Dolores answered it, listened for 5 seconds, and held it out to Lena. "It's for you," she said. There was something in her voice, not alarm, but the controlled neutrality of someone putting something on a shelf to deal with later. "It's from the base, Creighton Field. They're asking if you're present and what your status is." The room didn't go quiet. It was already fairly quiet, but something shifted in the air. Lena looked at the phone for 1 moment, then she took it. "Voss?" A male voice, older, with the measured delivery of someone accustomed to institutional communication. "Nurse Voss. This is Major Aldrich Tyne, Creighton Field Operations. We want to thank you for receiving our patients." "They're not stable yet," she said. "You can thank me after." A brief pause. "Of course. We're also reaching out because there may be additional incoming. The worksite collapse was larger than initially reported. We may have 2 more critical patients in the next 30 minutes. Lena looked at the bay around her. Farrow was stable. Obi was with Spalding. Margot was not yet fixed. The ER had 3 other active patients from before the helicopter had landed. The overnight staff was her, Dolores, Terrence, one other nurse who was currently managing the 3 pre-existing patients, and Aiden Torres. "We're under capacity," she said. "We understand. We're working on getting additional personnel to you." "How long?" 40 minutes. "Then I need at least 1 more nurse and 1 more resident right now, not 40 minutes from now. Can you facilitate that through the base?" Another pause, longer this time. "I'll make some calls." She handed the phone back to Dolores without ceremony and returned to Margot. Breck stepped forward. "You just told an army major to make some calls," he said. His voice was neutral, not angry, something else. "He was telling me things I already knew," Lena said. "I needed him to do something useful with his time." Breck looked at her. "Voss, who are you?" She didn't answer. She checked Margot's pressure, 79 systolic now, and called out to Terrence to run the second unit of blood faster. Breck stayed at the edge of the bay. He put his hands in the pockets of his coat, a thing she had never seen him do. It made him look smaller. Not smaller as in diminished, smaller as in human, like something protective had briefly come down. At 12:41 a.m., the 2 additional patients arrived. The first was a man named Grover Sills, 58, a foreman from the collapsed work site, with burns on his forearms and a penetrating abdominal wound from a piece of rebar that had gone through the left lower quadrant. He was awake, which was almost more alarming than if he hadn't been. People with serious penetrating trauma who stayed awake sometimes did so because their body hadn't processed yet what had happened to it. The second was a woman, 33, unconscious, with a crush injury to her lower legs. Her name from the field tag was Yvette Dorn. 2 more gurneys, 2 more medics. The bay, which had been stretched before, was now at the edge of what its physical space could accommodate. The nurse and resident that Major Tyne had promised had not arrived. Lena assessed Sills in 40 seconds. The rebar fragment had been stabilized in the field, not removed correctly, because the object itself was currently doing some of the work of keeping the bleeding contained. He needed surgery, and he needed it soon, but he was not about to die in the next 5 minutes. She told the medic to keep him still and went to Dorn. Dorn was worse. The crush injury had released something into her bloodstream, myoglobin from the destroyed muscle, and her kidneys were going to be in trouble if they weren't already. But the more immediate problem was her right leg, which had a vascular injury that one of the field medics had flagged but hadn't been able to fully assess. Breck was beside her before she asked. "I see it," he said. He was looking at the leg. "Popliteal?" "Possibly. She needs vascular." "Vascular is still with Pharaoh." "Then get them out of Pharaoh's room and into this one. Pharaoh is stable. She's not." Breck picked up the bay phone. He called the vascular team himself. That was the moment Dolores noticed, not Lena giving directions, but Breck following them. Dolores had been at Cascade Ridge for 15 years. She had seen Breck defer to exactly 2 people in those 15 years, both of them department chiefs from institutions that outranked his. She filed the observation somewhere quiet and kept working. Wikis materialized at Lena's elbow. "What do you need?" "You have TCCC training?" 8 years. "Then you know how to pack a wound. Look at the left leg. There's a secondary laceration that needs direct pressure and packing. Nobody's gotten to it yet. Can you do that without being in the way?" "Yes." "Then do it." He moved without ceremony. No offense taken, no ego to navigate, just a trained person doing what a trained person was asked to do. Terrence appeared on Lena's other side. "Margot's pressure is dropping again, 76. Lena was at the wrong end of the room. She looked at the clock. Maybay was somewhere in the hospital, should have been here by now, was not here. She made a decision. "I'm going to her," she told Breck. "You have Dorn?" "I have Dorn," he said. She crossed the bay to Margot. The child's monitor showed 76/40. Her heart rate was up. 148. The body's last-ditch effort to compensate for volume loss by beating faster and faster until it couldn't. Her face was pale in a way that had moved past concerning into something that sat in Lena's chest like a cold hand. "Mabe," she said to the room. "Where's Mabe?" "He called from the elevator," Dolores said from across the room. 1 minute. 1 minute. Lena looked at the child. She looked at the monitor. She looked at the ultrasound image still on the screen from earlier. The fluid pooling in the abdominal cavity, the spleen, if it was the spleen, bleeding in the slow, persistent way that patients alone wouldn't stop. She pulled the ultrasound probe again and placed it on the child's abdomen. The image that came back was different from 40 minutes ago. The fluid had increased, the pocket around the spleen was larger, and there was something else. A flicker of motion, a pulsatile quality to one of the fluid collections that didn't belong to normal abdominal bleeding. Lena stared at the screen. She had seen that pattern before. Not here, not in any American hospital. In a field surgical unit in a place she didn't discuss at work, with equipment that cost a fraction of what the hospital's ultrasound cost, in conditions that would have been unacceptable in any civilian context. She had seen it and been shown what it meant by a trauma surgeon who had explained it once and expected her to remember forever because in that environment forgetting was not an option. She remembered. The child didn't have a splenic laceration. She had a vascular injury, a tear in a branch of the splenic artery itself, which was bleeding into the surrounding tissue but also pulsing. The spleen was involved, but it wasn't the source. The source was vascular, and that changed everything because it changed what surgery needed to do and how fast they needed to do it, and what would happen if they went in expecting one thing and found another. Mabe walked through the bay door at that moment, coat on, gloves already on his hands, moving with the efficient haste of a surgeon who knew he was late. "What's her—" "Mabe." Lena turned the ultrasound screen toward him. "Look at this." He looked. He was a good surgeon, and he understood what he was looking at in about 4 seconds. His face changed. "That's pulsatile," he said. "Yes. She has a vascular injury, splenic artery branch, I think. The spleen is secondary." Mabe stared at the image for another 2 seconds. Then he looked at Lena, really looked at her, not as a nurse who had handed off a patient, but as a person who had just told him something that changed his surgical plan. "You're sure?" "I'm not a radiologist," she said, "but I'm sure enough that you should know before you open her." He nodded once. He pulled out his phone and called vascular. "I need Renata Spaulding on my case," he said into the phone. "Now, not after she's done with her current—" "Yes, now." He hung up. He looked back at Lena. "She needs to go up in the next 3 minutes." "I know," Lena said. "Come with me," he said, "to the OR." She looked at the bay. Breck with Dorn, Wicky's packing the wound, Terrence managing lines on sills, Dolores cycling between all of them. "I can't leave this floor." Mabe looked at her steadily. "I'm asking you to scrub in, not leave. Spaulding's never done a case with me. You apparently know what you saw in that image, and I need someone in the room who understands what we might be walking into." The silence stretched for 3 full seconds. "Breck," Lena said. Breck looked over from across the room. "Can you run this bay without me?" It was not the kind of question that was ever asked at Cascade Ridge Medical Center. It was especially not the kind of question a nurse asked an attending physician. It was the kind of question one equal asked another. Breck looked at the room. He looked at her. Something moved through his face. Not offense, and not quite the thing Lena expected either. Something that might have been, in different lighting, a complicated form of respect. "Go," he said. She pulled her gloves off, snapped new ones from the box, and followed Mabe out of the bay toward the elevator. Behind her, the bay continued its organized chaos. Monitors cycling, lines dripping, Dolores moving from station to station with the quiet efficiency of someone who had spent 15 years learning how to hold things together when they were close to coming apart. Wickies watched Lena leave. He watched the doors close behind her and Mabe. Then he looked at Dolores. "How long has she been here?" he said. 11 months, Dolores said. He shook his head slowly. "You people had no idea, did you?" It was not a question, exactly, and Dolores didn't answer it as one. She just kept working. Oh. The OR on the 3rd floor was cold the way ORs always were. A deliberate cold, the kind that kept infection rates down and made surgeons more alert and gave everyone in the room a specific baseline of discomfort to operate through. Lena had always found it clarifying rather than uncomfortable. She scrubbed in at the sink beside Mabe. Spaulding arrived 90 seconds later, pulling her hair back, looking at the situation with the appraising calm of a woman who had been woken up and brought back in and was not wasting energy on complaint. "Walk me through the image," Spaulding said to Lena. Directly. No preamble. Lena walked her through it. The fluid distribution, the pulsatile quality, the location, the differential reasoning. She spoke in the clinical shorthand of someone who knew the vocabulary not from textbooks, but from having used it under conditions where getting it wrong had consequences that couldn't be undone. Spaulding listened. Mabe listened. The scrub tech listened, though she didn't quite follow all of it. When Lena finished, Spaulding said, "Where did you train?" "Emergency medicine," Lena said. "Where?" A pause. The kind of pause that had a weight to it. "Mostly overseas." Spaulding looked at her for a moment. Then she looked at Mabe. "Okay," she said. "Let's go." They opened Margot at 1:09 a.m. What they found was what Lena had described. A tear in the inferior branch of the splenic artery, actively bleeding. The spleen itself was bruised and partially lacerated, but not the primary source. If they had gone in expecting to manage the spleen and packed accordingly, they would have missed the arterial bleed until Margot was in crisis on the table. They didn't miss it. Spaulding controlled the vessel. Mabe managed the spleen. The anesthesiologist, a tall, quiet man named Gus, who had been doing this for 22 years, kept Margot's pressure up with a precision that made the rest of the room's job easier. It took 2 hours and 17 minutes. When they closed and the anesthesiologist began reversing the sedation, Margot's pressure was 98/62, and her color had come back in the slow, incremental way of a body reclaiming itself. Lena stood at the sink afterward, washing her hands, and felt the particular specific exhaustion of someone who had been running on adrenaline and controlled focus for long enough that when those things release, the drop is total. Mabe came to stand beside her at the sink. "You caught that on a bedside ultrasound," he said. "In a trauma bay, at midnight, with 4 other critical patients in the room. The image was clear enough." "Lena." He waited until she looked at him. "That's not a nursing skill." She looked at the water running over her hands. "I know a lot of nurses who could have read that image." "Name one at this hospital." She didn't answer. Mabe shut off his faucet. "Spaulding is going to ask about you. The major from Creighton Field already called the administrator on call. I heard it from the OR charge nurse on my way up. And Breck..." He stopped. "Breck is going to have questions." "Breck always has questions," Lena said. "Different questions this time." She pulled a paper towel from the dispenser and dried her hands. She looked at her own reflection in the metal above the sink. Distorted, the way those reflections always were. More impression than image. She had been invisible for 11 months. She had arranged it that way, more or less. Not through deception, exactly. Through omission. Through not saying things that hadn't been asked. Through living the truth that the life she had now was the life she had chosen. And the life before it was a different country entirely. She had not counted on the helicopter. She had not counted on Wiki saying what he'd said, or the major calling the hospital, or Mabe asking her to scrub in, or the way Breck had looked at her when he said go, not like a physician managing his staff, but like a man who had just started to understand that he had been profoundly wrong about something. She had not counted on any of it, but here it was. Downstairs in the ER, she knew, Breck was standing in a trauma bay with a fuller picture of the night than he'd started with, and that picture had edges that didn't fit the frame he'd been using. And across town, in an administrative office she'd never been inside, someone was making a phone call that would reach her before she had a chance to decide what she wanted to say. She dropped the paper towel in the bin. She walked back to the elevator and pressed the button for the first floor. The doors opened. Standing in the elevator, badge on, tablet in hand, was the hospital's chief of staff, Dr. Orrin Kessler, a man she had met twice in 11 months, both times briefly, both times in the context of performance reviews that hadn't gone particularly well for her. He looked at her scrubs. He looked at the OR sticker on her sleeve that marked her as scrubbed-in personnel. "Voss," he said, I was just coming to find you." The elevator doors began to close behind her. Part 3. The elevator doors finished closing behind her, and for a moment the two of them were contained in that small metal box. Kessler, with his tablet and his carefully pressed shirt despite the hour. Lena in surgical scrubs with drying antiseptic still on her forearms, and neither of them spoke while the floor numbers changed. Kessler was 61, a former internist who had moved into administration 15 years ago and had the particular quality of men who had made that transition well. He understood clinical work well enough to not be fooled by people who didn't, but he had been away from it long enough that the instincts had softened. He was not a bad man. He was a man who ran an institution, and institutions had priorities that individual patients didn't always fit neatly inside. "Walk with me," he said when the doors opened at the first floor. She walked with him, not because he outranked her exactly, though he did, but because whatever he had to say was going to happen anyway, and she would rather hear it now than be ambushed by it later. He led her to a small conference room off the main administrative corridor, the kind of room that had a table and 4 chairs and a whiteboard with old marker notes that nobody had erased and a window that looked onto the parking structure. He closed the door. He set his tablet on the table and looked at her directly. "I've had 2 calls in the last 40 minutes, he said. One from Major Aldrich Tyne at Creighton Field, who wanted to personally thank Cascade Ridge for receiving their patients and specifically asked me to pass his appreciation to a nurse named Voss." He paused. "The second call was from a Colonel Marcus Dre, who asked me to confirm your employment status here and requested that we treat certain aspects of your background as," and I'm quoting him, "sensitive operational context, not for general disclosure." Lena said nothing. "A colonel," Kessler said, "called my personal hospital line at 1 in the morning. I can't speak to why he called." "Can't or won't?" She met his eyes. "Both." Kessler sat down. He didn't gesture for her to sit, and she didn't. He looked at his tablet, then set it face down, which meant whatever was on it was something he'd already decided not to lead with. "Lena, I have a performance review in my system that recommends probationary status for you, filed by Dr. Breck, co-signed by 2 of his residents. Physician collaboration scores below threshold, pattern of unauthorized independent clinical decisions." He stopped. "That review was scheduled to go to HR on Monday." "I'm aware of the review," she said. "I imagine you are." He folded his hands on the table. "I'm also now aware that tonight you triaged 5 critical patients from a military helicopter call, correctly identified a vascular injury on a pediatric patient using a bedside ultrasound that 2 surgeons subsequently confirmed in the OR, and scrubbed into a case at the direct request of the operating surgeon." He looked at her. "That's not a standard nursing skill set." "I have a broad background." "Apparently." He let that sit for a moment. "The question I'm trying to answer is why none of that background appears anywhere in your employment file." Lena looked at the window. The parking structure outside was lit in the flat yellow of overnight security lighting. A car moved through a lower level, headlights sweeping. "When I applied for this position," she said, "I submitted the credentials required for the role. I didn't submit anything that wasn't asked for." "That's technically accurate." "It's completely accurate." Kessler studied her. "Are you currently active duty?" "No." "Reserves?" "No." "Then what's the relationship with Creighton Field?" "I served there before I separated. The medics who came in tonight, some of them may have known me from that time, or known of me." She kept her voice flat, not hostile, just contained. "I can't control who calls you, Dr. Kessler. I can tell you that I'm a civilian employee of this hospital, and I've been doing my job." "You've been doing considerably more than your job description specifies," he said, "which puts me in an interesting position because the same man who filed for your probation is downstairs right now running a trauma bay that's handling a mass casualty event, and by all accounts, he's been taking direction from you for the last 2 hours." The room was quiet. "I didn't direct him," Lena said. "I made clinical observations. He acted on them. Because he trusted them." She didn't answer. Kessler stood up. He picked up his tablet. He had the expression of a man who had come into a room expecting to manage a situation and had discovered the situation was significantly larger than the room. "The review is on hold," he said. "Don't read too much into that. It's procedural, given the circumstances. But I need you to understand that this hospital is now in a position where we have military personnel asking about you, a colonel requesting confidentiality around your background, and a department chief who filed for your probation 4 days ago, now apparently deferring to your clinical judgment in an active trauma scenario. He stopped at the door. At some point, someone is going to want a full accounting of who you are and what you've done. If that conversation is going to happen, I'd rather it happen here first. He left. Lena stood in the conference room for approximately 15 seconds. Then she walked back to the ER. The trauma bay at 2 a.m. looked like the aftermath of something, which it was. The acute chaos had resolved into the slower, grimmer work of stabilization and documentation. Gurneys had been repositioned, equipment had been restocked or flagged for restocking. The floor had been cleaned once and would need cleaning again. Grover Sills, the foreman with the rebar wound, had gone to surgery 40 minutes ago. The rebar fragment had been removed under general anesthesia by a general surgeon named Dr. Paula Vega, who had spent 2 hours controlling the bleed and repairing the bowel segment the metal had transected. He was in the ICU and would be there for days, but he was alive. Yvette Dorn, the crush injury, had been stabilized enough for transfer to a vascular center 2 counties over that had a dedicated limb salvage team. The right leg was still uncertain. Nobody was saying the word amputation yet, but nobody was not saying it either. Farrow was in a regular room on the 4th floor. His wife had arrived and was with him. Sandra Obi had been admitted under neurosurgery observation. The subdural was stable. Spaulding had said carefully that they would watch it for 48 hours. And Margot was in the pediatric ICU, sedated, her small chest rising and falling with the mechanical assistance of a ventilator that would be weaned over the next day or two as she woke up enough to breathe on her own. The vascular repair had held. Her pressure was 102/64 and had been steady for the last 30 minutes. Lena came back into the bay and took all of this in by looking at the board and asking Dolores 2 questions. Anything still active? Sills is out of surgery. Dorn transferred 40 minutes ago. The 3 original patients from before the helicopter. 2 discharged, 1 admitted for observation. Staffing? We got 2 nurses from the float pool at 2 a.m. They're covering the floor. Dolores paused. Breck is in his office. Lena nodded. She went to the medication room and began reconciling the controlled substance log, which nobody had touched during the mass casualty event and which was now significantly out of sequence. It was detailed, tedious work, the kind of work that existed to ensure accountability and that fell apart spectacularly when a department was overwhelmed. And she did it methodically, cross-referencing the physical count against the electronic dispensing record, flagging discrepancies, noting the times and patient identifiers for each entry. It took 40 minutes. She was on the last page when Breck came in. He didn't say anything immediately. He stood near the doorway of the medication room, which was small, not really designed for 2 people to have a conversation in, more a functional alcove than a room, and looked at her working. "Kessler found you," he said finally. "He did. What did he say?" She kept counting. "He put the review on hold." A pause. "The performance review." "Yes." Breck was quiet for long enough that she looked up. He was leaning against the door frame with his arms crossed, but not in the aggressive posture he typically used, more like he needed the frame to lean on. "I wrote that review," he said, 3 weeks ago. I filed it because I thought—" He stopped, started again. "I thought you were a liability. I thought you were doing things outside your scope because you had poor judgment about where your scope was. I thought the EKG order, the cardiac flag, the way you handled the combative patient, I thought it was a pattern of someone who didn't understand the chain." He paused. "I was wrong." Lena set down her pen. She looked at him. "You weren't entirely wrong about the chain," she said. "I work outside protocol sometimes." "You work outside my protocol," he said, "which isn't the same thing." She considered that. "No, it's not." Breck looked at the ceiling for a moment, then back at her. "Who are you?" He'd asked it before, in the trauma bay. She hadn't answered. She still didn't fully answer now, but she said, "I'm a nurse who has done this work in places that didn't have the luxury of protocol." "The military." "Before this." "How long?" 8 years. She picked up the pen again. "I separated 14 months ago. I came here because Delmore was quiet, and I wanted quiet. Breck took that in. The colonel who called Kessler, I don't know why he called. I haven't been in contact with that command since I separated. But they know where you are. She didn't answer, because the answer was obviously yes, and they both knew it. Breck pushed off the doorframe. He looked like he was about to say something else and then changed his mind. What he said instead was, the write-up, the one from 6 months ago, about the medication order. I remember it. I'm going to correct it, he said it flatly. The pharmacy confirmed you were right. I should have amended it then. I didn't. A beat. I'll amend it. Lena looked at him for a moment. Okay, she said. He left. She finished the controlled substance log and filed it and stood in the medication room alone for just a moment, in the small quiet that the end of a crisis sometimes left behind. Not peace, exactly. More like the absence of immediate emergency, which was its own temporary relief. She was tired. She hadn't eaten since 6 p.m., the previous day. Her left shoulder was aching in the specific way it ached when she'd been on her feet for too long. An old injury that never fully resolved and probably never would. She went to the break room, ate half a granola bar she found in her locker, and drank water from the tap standing over the sink. Then she went back to work. At 4:15 a.m., Wickies found her at the nursing station. He'd stayed. She wasn't sure why, and she looked at him with the mild question that didn't need to be spoken. The major asked me to stay on site until we had a status update on all 3 original patients, he said. I've been in the waiting area. They're all stable, she said. I know, Dolores told me. He sat down in the chair across the station from her. He was a compact man, maybe 40, with the weathered quality of someone who spent significant time outdoors in conditions that weren't optional. I owe you an apology. For what? For what I said in the trauma bay. The heart comment. She looked at him steadily. Forget it. I assumed a connection that I shouldn't have stated out loud. In front of civilians. He used the word without emphasis, just descriptively. It was sloppy. I said forget it, Wicks. He nodded. He looked at the station board for a moment. The girl, Margot, the medic who brought her in, Corporal Vale, she's been asking about the outcome. She's in the PICU, stable, vascular repair held. They'll wean the vent tomorrow if she continues the way she's going. Something shifted in Wicks's face, small, quick, the micro-expression of someone receiving news they'd been braced not to receive. Relief that comes out looking like its opposite for just a second before the face settles. Good, he said. That's good. Tell Vile she did her job. The line management in the field, keeping the airway. That bought us enough time. I'll tell her. He stood. He picked up his field jacket from the back of the chair. One more thing, he said. He said it without looking at her, reaching for his jacket. There are people at Creighton who've been asking about you since you separated. Whether you were doing okay, whether the transition was... He stopped. He put on his jacket. You should know that, not because you need to do anything about it, just so you know. Lena looked at her chart notes. I'm doing okay, she said. I can see that, he said, and left. Up. The shift ended at 7 a.m. The day staff arrived in the particular organized energy of people who had slept and eaten and were not yet aware of what the night had been. The charge handoff took longer than usual. Dolores gave it because Dolores had been there for all of it, and her account was thorough and dry and accurate in the way that Dolores's accounts always were. Lena changed out of her scrubs in the locker room. She put on jeans and a gray sweatshirt and her jacket. She sat on the bench and tied her shoes and felt the weight of 17 hours of sustained alertness beginning to make its full claim on her body. She was almost at the exit when Aiden Torres caught up with her. He was still in his residence coat, end of night shift, looking like he'd been run over by something, but was oddly okay about it. Voss? He said. She stopped. The Okafor patient, he said, from 3 weeks ago, the AAA. I remember. I looked back at my notes from that intake. I documented abdominal discomfort, possible GI. He said it like a man identifying a specific point of his own failure. You came to me 2 minutes after I'd done the intake and told me something was wrong. I did. I thought you were overstepping. You ordered the scan. Eventually. He looked at her. 3 minutes later than I should have because I spent those 3 minutes deciding whether to be annoyed at a nurse who I thought was... He stopped. Anyway, I looked it up. The surgeon said 30 minutes more and he probably doesn't survive. Those 3 minutes could have... But they didn't, Lena said. No. He stood in the hallway with the uncertain energy of someone who had prepared a speech and discovered the audience had a different response than expected. I just wanted to say I understand now why you work the way you work, and I was wrong to read it as insubordination. She looked at him. He was young, 28, maybe 29, with the particular combination of intelligence and arrogance and underlying panic that the good ones usually grew out of. You ordered the scan when it mattered, she said. That's what counts. She went home. She slept for 6 hours. Not well. Not deeply. The kind of sleep that happened in segments, interrupted by the body's residual alertness, the nervous system still scanning for inputs that weren't there. She woke at 1 p.m. and lay still for a moment, and then got up and made coffee and stood at her kitchen window and looked at the rain. Delmore in November was a gray place. Low sky, persistent wet, the mountains at the edge of the valley visible only on clear days and invisible for weeks at a time. She had chosen it for reasons that seemed clear to her at the time. Distance, anonymity, a hospital that wasn't prestigious enough to attract attention, and those reasons had mostly held up. Until last night. Her phone showed 3 missed calls. One from a number she didn't recognize with a Creighton Field area code, one from Dolores, which she would return, and one from a number she recognized immediately and had not expected to see, a number she had stored under a name she'd abbreviated so that only she would know who it was. She looked at that last entry for a long time. She didn't call it back. She called Dolores instead. "How's the floor?" she said when Dolores picked up. "Quiet. Day shift is managing." A pause. "Kessler came down this morning. He asked the charge where you were. When she said you'd gone home, he seemed relieved. That's not encouraging. It means he's not ready to have the next conversation yet, which buys you time." Dolores paused again. Breck amended the write-up. Lena set down her coffee. "Already?" "This morning, before he left, the HR director called the charge to let her know it was in the system." Another pause, shorter. "The residents are talking. Word moves fast in a small ER." Lena looked at the rain on the window. "Dolores?" she said. "Yeah. Thank you for last night. Don't thank me. I just did my job." But the warmth in Dolores's voice was audible under the plainness of the words. "Get some sleep. You sound like you need more of it." She hung up. Lena refilled her coffee and sat at the small table in her kitchen and thought. The events of the night had not been catastrophic for her. Not yet. The patients had survived, or were in the process of surviving. Breck was revising his position. Kessler was cautious but not hostile. Aiden Torres was processing. Wickies had gone back to Creighton Field and taken his implied knowledge with him, but the colonel had called, and that was the piece she hadn't planned for. Colonel Marcus Dre was not a man who made phone calls lightly. He was a man who made phone calls when situations had already moved past the point where not calling was an option. If he had called Kessler last night, it meant he had been watching the situation closely enough to know the helicopter call had happened and had decided that the hospital administration needed to be managed before it started asking questions in the wrong direction. The question was, managed toward what? Her phone rang again. The Creighton area code. This time she answered. "Voss?" she said. The voice on the other end was not Major Tyne. It was not anyone she'd expected. It was a woman's voice, measured, precise, with the particular authority of someone who had spent years being the most competent person in any given room and had stopped making adjustments for it. "Lena?" the voice said. "It's Hargrove." Lena put her coffee down. Brigadier General Ruth Hargrove, former commanding officer. The woman who had, 8 years ago, recruited a 26-year-old trauma nurse from a Portland hospital and put her through a program that most people never heard existed. The woman who had, 3 years later, told Lena she was the best combat medic she'd ever supervised, and meant it clinically, not as a compliment. The woman who had signed Lena's separation papers with a note in the margin that said simply, You can always come back. General, Lena said. Retired now. Just Ruth, if you can manage it. A pause that wasn't quite a pause, more like a breath that had been held briefly and released. I heard you had a long night. I did. The child survived. She did. Because of the image read, Lena looked at the wall. Because of the surgical team. Because you saw it first. Another pause. Lena, I'm not calling to debrief you. I'm calling because you need to know something before it reaches you through other channels. The rain against the window was steady and even. Tell me, Lena said. Dre's call to your hospital administrator was not entirely about last night. It was partially about managing disclosure, but the reason he was watching the situation closely enough to know the helicopter call had happened. She stopped. There's been an inquiry, a formal one. It was opened 6 weeks ago. Lena went still. Into what? Into the circumstances of your separation. Hargrove's voice was careful in the way that careful voices are when they are managing the impact of information that is going to land hard. Specifically, an allegation that your conduct during your final deployment constituted unauthorized operation outside sanctioned parameters. The allegation was filed by someone with access to your service record and enough institutional standing to get it taken seriously. Lena stood up. She walked to the window and stood with her hand against the glass. Who filed it? She said. It wasn't a question. She already knew what category of person it had to be. She just needed the name. Hargrove said it. And Lena closed her eyes for exactly 3 seconds. Not from shock, because she had known this was possible, had known it the day she separated, had known it every month since, but from the specific cold reality of something you've been watching approach in your peripheral vision, finally arriving directly in front of you. He's been at the VA office in Portland since last spring, Hargrove continued. He has the paperwork and he has testimony from 2 people who were on the same deployment. The inquiry board convenes in 3 weeks. 3 weeks. What are the potential outcomes? Lena said. Best case, dismissed for insufficient evidence. Middle case, formal reprimand, revocation of certain commendations. Worst case, Hargrove stopped. Worst case, it reaches civilian licensing boards, medical boards, Oregon Nursing Board. Lena took her hand off the glass. Her nursing license. Her ability to work. Everything she had rebuilt in 14 months. Does Dre know the basis of the allegation? She said. Dre knows enough to know the allegation is being filed in bad faith. He can't say that officially. But he made the call to your hospital to create a record, to establish, before the inquiry board convenes, that your clinical judgment is sound and that you are currently operating effectively in a civilian medical context. Hargrove paused. He was trying to help you, clumsily, because that's how Dre does most things, but genuinely. Lena looked at her kitchen, the half-empty coffee cup, the rain on the window, the small, ordinary fact of her apartment, which was not a place she'd decorated or invested in because she hadn't been sure she'd be here long enough to bother. The 2 witnesses, she said. Who are they? Hargrove named them. Lena stood very still. One of the names she'd expected, the other one she had not. And the second name was worse than the first, because the second person had been there when the thing in question had happened, had seen exactly what she'd done and why, had at the time said nothing to indicate objection, had in fact done what she'd asked and then walked away, and had apparently spent the months since constructing an account of it that looked very different from what she remembered. Lena, Hargrove said, I'm here. The board date is the 14th of next month. You'll receive formal notice in the next few days. When you do, don't respond to it directly. Call me first. Why are you involved in this? A long pause, the longest so far. Because I've been watching what this person has been building for the last year, and I am not going to let it take down the best medic I ever trained without doing what I can to stop it. Hargrove's voice was steady, but underneath the steadiness there was something that on a different person might have been called anger. On Hargrove it was just density, weight, the quality of someone who had made a decision and was not changing it. And because what you did on that deployment was right, not unauthorized, right, and I was the commanding officer, and I should have made that case more clearly at the time. Lena sat back down at the table. You couldn't have known he'd wait a year, she said. No, but I should have documented it better, in real time. A pause. I'm sorry, Lena. This is partly on me. Lena looked at the table. She thought about the pediatric bay last night, Margot's pressure dropping, the image on the ultrasound screen, the decision to speak up about what she saw even when nobody had asked for her analysis, the way Mob had looked at her in the OR, the way Breck had said go. She thought about a performance review that had recommended her probation, filed by a man who now understood he'd been wrong. She thought about what it meant that the same instincts that made her good at this work, that made her unwilling to stay quiet when she could see something that others couldn't, were the same instincts that had put her in the position she was in now, both here and in the inquiry. Okay, she said. Okay? I'll wait for the notice. I'll call you first. She paused. Who's running the inquiry board? Hargrove told her. And the name she heard was the second thing in the last 10 minutes that she hadn't anticipated, because it was not a name from the military, and not a name from Creighton Field, and not a name that belonged to anything connected to her service record. It was the name of the deputy director of the Oregon State Board of Nursing, which meant the inquiry had already moved. It had already moved past the military channels and into the civilian licensing structure, and the formal military inquiry was not the primary threat. It was the cover. The real mechanism was already in motion, already pointed at the one thing that couldn't be replaced. Her license, her right to do this work, the 11 months she had spent building something quiet and functional out of the rubble of everything that had come before. Her phone was still in her hand. She heard Hargrove saying her name, asking if she was still there. And from the hospital, her phone buzzing on the table with a second call coming in, the number showing as Cascade Ridge Medical Center's main line, which at 2 p.m. on a day she wasn't scheduled to work meant someone had specifically looked up her number and made a deliberate choice to call it. 2 calls. 2 directions. And somewhere in a Portland office building, a man she had once trusted was sitting across a table from a deputy director and explaining, in careful institutional language, why a nurse named Lena Voss should not be allowed to practice medicine. She answered the hospital call first. Voss, she said, and held up one finger toward the phone with Hargrove on it, a meaningless gesture since Hargrove couldn't see her, but the body did what the body did under pressure. The voice on the Cascade Ridge line was not Kessler and not Breck. It was a woman she didn't recognize, administrative, measured, reading from something. Ms. Voss, this is Patricia Sloan from Hospital Legal Affairs. We've received a formal inquiry notice from the Oregon State Board of Nursing regarding your licensure status. We're required to notify you that the board has requested your employment records, including performance documentation, incident reports, and clinical history within the next 10 business days. A pause. Dr. Kessler would like to schedule a meeting with you at your earliest convenience. Lena looked at the rain on her window. 10 business days. They had already sent the formal request to her employer before she'd received personal notice. That was the sequence. Hit the employer first. Create institutional anxiety. Let the workplace pressure do some of the work. Whoever had filed this understood exactly how to use the bureaucratic machinery. Tell Dr. Kessler I'll come in tomorrow morning, she said. She hung up and put Hargrove back to her ear. The board already contacted the hospital, she said. A silence that meant Hargrove had not known that, but was not entirely surprised. How long ago? The notice just arrived. They're asking for 10 days of records production. Lena stood and walked to her kitchen counter. She needed to think in a different position. This was filed before last night, before the helicopter. Yes. Which means whoever filed it did so while I was still on the probation track at Cascade Ridge, while the performance review was active. She stopped. If I'd been terminated, my employment records would have shown cause. The board inquiry would have had traction. Another silence. Longer. Lena, Hargrove said, the timing wasn't coincidental. She said it clearly, as a statement she was making to herself as much as to Hargrove. The inquiry and the performance review were parallel tracks, one military, one civilian, both pointing at the same outcome. I didn't know about the hospital review, Hargrove said. I know. Lena looked at the ceiling. Who does? Who has access to both my service record and knowledge of my current employment situation? Someone who's been tracking me since separation. The name Hargrove had given her 30 seconds ago was still sitting in the front of her mind. The one she hadn't expected, the one who had been there. His name was Lieutenant Colonel Preston Vale, and he had been, during the deployment in question, her direct superior in the field surgical unit. He had also been, in the 3 months before she separated, the subject of an informal report she had filed regarding medication inventory discrepancies in the unit's controlled substance supply. She had filed it quietly, through proper channels. She had not made accusations, only documented what she'd found and handed it to the relevant oversight officer and stepped back. She had not known, at the time, whether anything had come of it. She knew now. He was investigated, she said. It wasn't a question. Briefly, Hargrove said, nothing was formally substantiated. The inquiry closed in the spring, but the process... She stopped. The process apparently left him with a detailed awareness of who had initiated it. Lena pressed the heel of her hand against the counter. She had filed that report because the math hadn't added up, because patients in her care were receiving inconsistent pain management outcomes, and she had traced the inconsistency back to supply logs that showed consumption exceeding documented administration. She had done it because it was the right clinical and ethical thing to do, and because doing nothing would have meant patients suffering unnecessarily while someone with access to the supply chain redirected medications for other purposes. She had not done it to protect herself. She had done it and then moved on, the way she always moved on, forward, to the next patient, the next shift, the next problem. And Vale had spent a year building a case designed to take her license. What did he allege? She said. Specifically, unauthorized independent surgical intervention during the Caldar operation, specifically that you performed a field procedure outside your sanctioned scope without physician authorization, resulting in... Hargrove paused. He's claiming the patient had an adverse outcome attributable to your intervention. Lena went very still. The Caldar operation. 8 months before she separated. A forward operating base 2 hours from the nearest surgical unit, a soldier with a penetrating chest wound and a collapsed lung who had been losing pressure for 22 minutes while the physician attached to the unit was incapacitated. A head injury from the same engagement that had put the soldier down. She had done a needle decompression. She had done a finger thoracostomy when the decompression wasn't sufficient. She had kept him alive for 94 minutes until the medevac reached them. The soldier had walked out of a rehabilitation facility 11 months later. She knew because she had received a letter. 1 letter, 2 paragraphs, signed by a man named Garrett Tolliver from Missoula, Montana, who said he had a daughter and that she would grow up with a father and that he wanted someone to know that. She had kept the letter. The patient had a full recovery, she said. Her voice was completely flat. I know, Hargrove said. I have his medical records. Vale knows too. The allegation isn't about the outcome. It's about the authorization. He's arguing that regardless of outcome, you operated outside your scope and created liability for the unit, and that your history of doing so, citing multiple instances from your service record, including things that were never filed as violations at the time, represents a pattern of disregard for sanctioned medical authority. She understood it now, completely. It wasn't about Caldar, it was about pattern. Vale had gone through her entire service record and identified every instance where she had made an independent clinical decision, every time she had acted on what she knew instead of waiting for a physician to authorize it, and reframed each one as insubordination. The same qualities that had saved lives in the field, the same instincts that had caught Margot's vascular injury last night, reconstructed as evidence of a dangerous nurse who didn't follow rules. The performance review at Cascade Ridge, filed by Breck, had used almost identical language, resistant to collaborative protocols, difficult to direct, pattern of unauthorized independent clinical decisions. Vale had seen it, or he had shaped it. She didn't know which yet. Hargrove, she said, did Vale have any contact with Cascade Ridge Medical Center before last night? A long pause. I don't know, Hargrove said. Find out, Lena said, and hung up. That. She was at the hospital at 8 a.m. the next morning. She had slept badly, woken at 5, run 3 miles in the dark and the rain because her body needed to do something physical, or it would spend the remaining hours before the meeting reconstructing conversations and outcomes that hadn't happened yet. She came back, showered, 8. Put on clothes that were not scrubs, dark trousers, a plain sweater, her jacket, because she was not coming in as a nurse today. She was coming in as a person who needed to be taken seriously in a room. Kessler's office was on the 3rd floor, administrative wing, a corner room with a view of the parking structure from one window and a sliver of mountains from the other. His assistant, a quiet man named Warren, who had the careful energy of someone who absorbed institutional tension and metabolized it into efficiency, told her to go in. Kessler was at his desk. Breck was also in the room, which she had not expected. He was standing near the window with his coat on, which meant he had come in specifically for this and not as part of his regular shift. There was a third person, a woman Lena didn't know, mid-50s, dark blazer, a legal pad, and a laptop on the table in front of her. Hospital legal affairs. Patricia Sloan, presumably, from the phone call. Lena sat down. "Thank you for coming in," Kessler said. "You asked me to." "Yes." He folded his hands. "We've received a formal records request from the Oregon State Board of Nursing. We're legally required to comply. I want you to know that before we produce anything, our legal team will review everything that goes out." He nodded toward the woman. "Patricia will be managing that process." Patricia gave Lena a small professional nod. She had the expression of someone who had seen variations of this situation before and was reserving judgment on the specifics. "I need to tell you something," Lena said, "before we discuss the records request." Kessler looked at her. She told them. Not everything. Not Hargrove. Not the full operational context of the Caldar deployment, but the shape of it. That the board inquiry appeared to have been initiated by a former superior officer against whom she had filed an internal misconduct report. That the timing of the inquiry, coinciding with her probationary review at Cascade Ridge, was not coincidental. That she believed the two processes had been coordinated, or at minimum that the inquiry had been filed with awareness of her employment situation. The room was quiet when she finished. Breck was still at the window. He had turned to look at her during the account and hadn't looked away. Kessler said, "You're alleging that a military officer filed a licensing board complaint in coordination with, what, your performance review here?" "I'm not alleging coordination," she said. "I don't have evidence of direct contact. I'm telling you that the timing, the language, and the strategic structure of both processes are consistent with someone who wanted to create professional vulnerability from multiple directions simultaneously." Patricia wrote something on her legal pad. "If that's true," Kessler said, and I want to be careful about that word, if there was contact between this officer and anyone at this hospital with the intent to influence your employment status, that would be significant, Patricia said. She said it with the controlled tone of someone who was already thinking about what significant meant from a liability standpoint for the institution. "I need to know," Lena said, "whether anyone from Creighton Field or connected to a Lieutenant Colonel Preston Vale contacted this hospital prior to last Thursday. Anyone who might have discussed my background, my employment, my performance." Kessler looked at Patricia. Patricia looked at her laptop. She typed something. She waited. Then she looked up, and her expression had changed in a specific way. The way that expressions change when information arrives that requires immediate reassessment. "There's a call log," she said. She said it carefully. "From 6 weeks ago. An inquiry call to the HR department about a nursing staff member. The caller identified himself as a reference verification contact." She looked at Kessler. "It appears the HR receptionist treated it as a routine call. It was logged, but not flagged." The room was very quiet. "Who took the calls?" Kessler said. Patricia looked at the screen, said a name. Breck pushed off the window. "That's my administrative coordinator," he said. Everyone looked at him. He had the expression of a man who had just found a seam in the wall of a room he thought he knew and was calculating what was behind it. "She routes my performance review documentation," he said. "She processes the resident feedback scores." Lena said nothing. She watched him work through it. "Someone called 6 weeks ago, identified as a reference contact, and my coordinator took the call," he said slowly. "And 3 weeks ago, I filed a performance review recommending probation." He stopped. "I filed it based on the accumulated feedback scores, which she compiles." "Raymond," Kessler said, "I'm not saying she did anything." He stopped again. His jaw tightened. I'm saying I don't know what she did, and I should find out before I say anything else. Patricia was already typing. What happened over the next 4 hours was not a clean unraveling. It was the grinding, uncomfortable stop and start process of institutional investigation, which moved slowly and generated paperwork and required Patricia Sloan to make several phone calls to people who had to be persuaded to produce records they had not planned to produce. Lena was not in the room for most of it. She was asked to wait. First in the conference room down the hall, then, when that felt too much like being held, she walked to the cafeteria and drank coffee and watched the morning shift move through the food line and thought about what she knew and what she didn't. What she knew: Vale had filed an inquiry. 2 witnesses, one expected and one not, had provided testimony. The board process was already in motion. The records request to the hospital was active. What she didn't know: whether the HR call 6 weeks ago could be attributed to Vale directly or to someone working on his behalf, or whether it was something else entirely. Whether Breck's coordinator had passed information or had simply been a conduit for a conversation that hadn't required her to do anything deliberate. Whether the connection, if it existed, was provable in any meaningful sense within the time frame of a board inquiry. Dolores found her in the cafeteria at 10:30. She sat down across from her without asking and put her own coffee on the table. Word travels, Lena said. In this hospital, it travels at the speed of the elevator, Dolores said. What's happening upstairs? Legal review. Dolores looked at her. Are you okay? Lena considered the question honestly, which was something she didn't always do. I'm not sure yet, she said. That's a more honest answer than I expected. I'm tired of managing my answers. Dolores wrapped both hands around her coffee cup. She had the quality of someone who had been through enough that honesty from other people didn't require a response from her, just reception. Petra Osman came in early today, Dolores said after a moment. She asked about you. She heard about the helicopter, and she wanted to know how it went. Tell her it went. She said something else. She said she ran into the army medic, Wickies, in the parking lot this morning. He was still here. Lena looked up. He spent the night? She said. Apparently. Dolores kept her voice neutral. He told Petra he was waiting to hear the status on Margot before he drove back to Creighton, but Petra said he'd been in the parking lot since about 6 a.m. making phone calls. Lena thought about that. Wickies was not a man who lingered without reason. He'd been in the field long enough that his movements were intentional by default. If he'd stayed in the parking lot making phone calls, it was because someone had asked him to stay, or because he had information that made staying the right operational choice. She stood up. Where is he now? She said. Petra said the lobby. Lena left her coffee and walked to the lobby. Wickies was there, not sitting, standing near the far window with the posture of someone who had been standing in uncomfortable positions for so long that standing was his default state. He saw her before she saw him and tracked her across the lobby without changing his expression. She stopped in front of him. You stayed, she said. I had calls to make. To who? He looked at her for a moment. Before I answer that, I need to know if you've been formally notified about the board inquiry. I have. And you know who's behind it? Vale, she said. Yes. He nodded once. He shifted his weight, a barely perceptible movement. What I'm about to tell you didn't come from me, meaning I'm not in a position to be a named source for anything. You understand? Yes. Vale's original misconduct inquiry, the one that closed in the spring. The investigating officer was a Major Delphin from JAG. When the inquiry closed, Delphin made a note in the file that evidence was insufficient to support the allegation at that time. He paused on those words. At that time. Which means he wasn't satisfied. He documented it. Which means it's part of the file, which means if the file is reopened, the internal military inquiry can be reopened, she said. If new evidence is submitted, yes. He looked at her steadily. There's a medic out of Creighton Field who was in the supply unit during the deployment in question. She came forward 2 weeks ago, not to the board, to Delphin directly. She had records, inventory records, transaction logs, things she'd held onto because she didn't know who to trust with them at the time. Lena's hands were still at her sides. 2 weeks ago, she said, Delphin submitted a request to reopen the Vail inquiry 5 days ago. That request is currently sitting on a desk at JAG, waiting for authorization. He paused. The timing, relative to the board inquiry Vail filed against you, Delphin is aware of it. He's aware of the sequence. Why are you telling me this? Wicks looked out the window at the parking lot. Because you kept a 7-year-old girl alive last night, and the man trying to take your license did it to protect himself from a report you filed because you were doing your job. He looked back at her. And because the people I work with, the ones who know what you did at Caldar and everywhere else before that, they're done watching from the side. He reached into his jacket pocket and took out a card. Plain, military issue, just a name and a number. That's Delphin, he said. He's not going to call you. He can't. But if you wanted to submit a voluntary statement to support the reopened inquiry, that's the contact. She took the card. Wicky's put his jacket back on. The corporal who brought Margot in last night, Vail. She wanted me to tell you something. Lena waited. She said she was 3 minutes from calling it when the helicopter landed at your facility. She said the girl had stopped responding to stimulus and she didn't think she was going to make it to the OR. He paused. She said tell you, 3 minutes. He walked out of the lobby. Lena stood with the card in her hand. Oak. By 2 p.m., the picture was larger and worse and better simultaneously. Patricia Sloan had obtained the call log from HR and confirmed that the reference inquiry 6 weeks ago had come from a number registered to a consulting firm in Portland. The consulting firm, when Patricia's team ran it, had a registered agent who had previously worked for a legal services company that counted among its clients several military officers navigating post-service disputes. It wasn't Vail's number, but it was close enough to his orbit that connecting them was a matter of 1 degree. Breck's coordinator, a woman named Sandra Firth, who had been with the hospital for 4 years, had been interviewed by Patricia for 40 minutes. She had not deliberately passed clinical information to a third party, but she had confirmed in the interview that she had received a call from someone identifying as a professional reference verifier and that the caller had asked several questions about Lena's performance record and specifically about any documentation of independent clinical action outside physician orders. Firth had answered the questions. She had thought it was routine. She had given whoever was on that call exactly the ammunition they needed to know that a performance review recommending probation was either already in progress or could be made to happen. Breck came to find Lena at 2:30. He found her in the medication room. She'd been restocking because the alternative was sitting somewhere waiting, and she didn't do that well. Sandra didn't know what she was doing, he said. I know, Lena said. The review. The way the feedback scores were weighted. I relied on her summary. I didn't go back to the primary sources. He stopped. I'm not blaming her. The decision to file it was mine. But the scores she gave me, the summary of the incident reports, some of it was accurate and some of it was framed in a way that I wouldn't have framed it if I'd gone back to the raw documentation myself. Lena looked at him. How different? He handed her a single sheet of paper. A printed comparison. On the left, the summary Firth had compiled. On the right, direct quotes from the underlying incident reports. The difference was not fabrication. It was selection. Which sentences were included, which were omitted, which incidents were grouped together to create a pattern that the raw data didn't actually show. Someone had called Firth, had learned exactly what information she compiled and what she had access to, and had understood that a competent but somewhat hands-off supervisor could be guided to a particular conclusion by a particular presentation of data. It was sophisticated. It was patient. It was the work of someone who understood institutional systems and how they failed. I should have checked my sources, Breck said. That's on me. Yes, Lena said, not cruelly, just clearly. He looked at the sheet she handed back to him. What do you need from me? She thought about it. A corrected record. Everything, every incident I flagged, every clinical decision I made. I want it documented accurately with your name on it, stating your current assessment. I'll do that today. Patricia needs it for the records production before it goes to the board. I understand. He took the sheet. He looked like he wanted to say something else and was having difficulty finding the form for it. "Breck," she said. He looked up. "The cardiac patient, Mrs. Fournier, 6 months ago." He nodded. "If I'd waited for your order, she would have arrested in the hallway." He held her gaze. "I know. I need you to put that in writing too. Not the conclusion, just the timeline. What time I flagged it, what time the EKG was run, what the results showed, what cardiology found." "Done." He left. Lena stood in the medication room and looked at the supply shelves. IV lines in their packaging, saline bags in graduated sizes, medication vials arranged by class and alphabetically within each class. She had organized this room herself in her second week because the previous arrangement had made it slower to find critical medications in an emergency. Nobody had asked her to do it. Nobody had thanked her for it. It was just there now, functional, slightly better than it had been. That was most of what she'd done here. Small functional improvements that nobody fully saw. She was done being invisible about it. At 4 p.m., Kessler called her back to his office. Patricia was there. Breck was not, but he'd sent the corrected documentation electronically. Patricia had it open on her laptop. Kessler looked like a man who had spent the day looking at things he hadn't known were there and was recalibrating on the fly. "The records we're producing to the board," he said, "will include the corrected performance documentation, the full incident chronology with Dr. Breck's revised assessment, the clinical record from last night's mass casualty event, and a letter from this institution regarding your employment status and conduct." He paused. "That letter will be supportive." "I'd like to review it before it goes out," Lena said. "Of course." He nodded to Patricia. "The write-up that's currently in your file. The original one from 6 months ago. That's being removed. The correction Breck filed supersedes it. The probation recommendation is withdrawn." "Okay," she said. "I also want to address the board timeline directly." He picked up a printed page. "The inquiry board is convening on the 14th. We have 10 business days to produce records, which takes us to the 12th. I've asked Patricia to prioritize this so we can have everything to the board early, by the 8th, ideally. The fuller the record and the earlier it arrives, the more time the board has to see the complete picture before the hearing." Lena looked at Patricia. "Is that achievable?" "If Breck's revised documentation is finalized by tomorrow and we get the OR records from last night cleared for release, yes," Patricia said. "They'll be cleared," Lena said. Kessler leaned back slightly. He had the look of a man settling into something he'd decided. "I'm going to be direct with you, Lena. This hospital handled you badly. Not maliciously. I don't think anyone in this building set out to undermine you. But we missed what you were doing and why you were doing it, and the systems that were supposed to protect good clinical practice instead got used against you." He paused. "That's a failure of institutional oversight, and it falls on me." Lena looked at him. "I'm not looking for an apology," she said. "I know. I'm giving you one anyway." He straightened the papers on his desk. "What I'm asking for, going forward, is that you don't leave." She hadn't expected that. She showed it only in the half-second delay before she spoke. "I'm not planning to." "Good." He picked up his pen. "Because last night demonstrated something that I want to build on, and I can't do that if the person who demonstrated it isn't here." She left his office at 4:20 and stood in the hallway outside and let the afternoon move around her for a moment. Orderlies passing, a cart rolling toward the elevator, the overhead PA announcing something in the flat, helpful voice of hospital overhead PAs. Then she took out the card Wikis had given her. She went to the stairwell, the one quiet place in the building that the PA didn't reach, and sat on the third-floor landing and called the number. It rang twice. "Delphin," said the voice. "This is Lena Voss," she said. "I'd like to submit a voluntary statement in support of the reopened inquiry into Lieutenant Colonel Preston Vale." A pause. Brief. Professional. The pause of a man who had been waiting for a call but was not going to show that. "Ms. Voss," he said, "can you be in Portland on Friday?" She thought about Margot in the PICU, about Pharaoh on the 4th floor, about Sandra Obi being monitored under Spaulding's careful eye, about the medication room she'd reorganized in her second week and the cardiac patient she'd flagged, and the AAA she'd caught, and the 11 months of small functional improvements that nobody had given her credit for until now. "Yes," she said. 9 a.m., Delphin said. "I'll send you the address." She ended the call and sat in the stairwell for another 30 seconds. The stairwell was cold and smelled of concrete and cleaning solution, and the light from the fixture above her was the flat utilitarian light of institutional infrastructure, ugly and honest and entirely without pretense. She was not finished. The board hearing was still coming. Vale was not dismantled yet, only pressured. The witness who had surprised her, the name she hadn't expected, was still on the other side of this, and she didn't yet know why they'd agreed to testify against her, which meant she didn't know what they'd been told or offered or threatened with. There were still pieces she didn't have. But on Friday, she would sit across a table from a JAG officer who had documented his dissatisfaction with a closed inquiry and had reopened it, and she would give him everything she had in the exact order it had happened, with the specificity of someone who had never stopped knowing that the Kaldar deployment was going to matter eventually, just not like this, not for this reason, not with this much on the line. She stood up. She pushed open the stairwell door and walked back into the hallway. At the far end of the corridor near the nursing station, she saw Aiden Torres talking to Dolores. He looked up when she came through the door, and something in his face that had been uncertain the last time she'd seen him had settled into something more definite. He gave her a small nod, the kind that meant, "I know what's happening and I'm not neutral about it," and went back to his chart. Dolores didn't even look up. She just said, without breaking from what she was doing, "There's a call for you at the station, Portland area code." Lena walked to the station and picked up the receiver. "Voss?" she said. The voice on the other end was not Hargrove and not Delphin and not Kessler and not anyone connected to any part of the institutional structure she'd been navigating all day. It was a man she had not spoken to in 14 months, a man she had trusted completely, once, and had continued to trust until his name had come out of Hargrove's mouth the previous afternoon as one of the two witnesses who had agreed to testify against her. His name was Sergeant First Class Owen Brierly. He had been her partner in the field surgical unit for 3 years. He had been in the vehicle with her on the day of the Kaldar operation. He had handed her the needle when the physician went down. He had held the soldier's airway while she worked. "Lena," he said. His voice was wrong, not the steady voice she remembered. There was something tight in it, something compressed. "I need you to listen to me." She gripped the receiver. "You have about 30 seconds, she said, to tell me why your name is on that testimony." "Because Vale has my sister," he said. The nursing station moved around her, Dolores sorting papers, a tech rolling past, the PA murmuring something distantly overhead. "What does that mean?" she said. "She works for the VA in Seattle. She's been under an audit for 6 months for a billing irregularity that she didn't commit." His voice was very controlled, which was how she knew exactly how scared he was. "Vale knows the auditor. He told me 6 weeks ago that the audit goes away if I give him a statement. He told me what to say." Lena looked at the wall. "Owen, she said. "I know," he said. "I know what I did. I'm calling because last night I saw the news alert about Cascade Ridge and the helicopter call and the pediatric patient, and your name was in it, and I—" He stopped. "I can't let him do this to you. I can't." She thought about the card in her pocket, the JAG officer's number, the meeting on Friday. She thought about Brierly holding a soldier's airway in a forward operating base while she did what needed to be done. "Can you document the coercion?" she said. "I have texts. I saved everything." A pause. "Lena, I'm sorry. I should have— Can you be in Portland on Friday?" A silence. "Yes," he said. 9 a.m., she said. "I'll send you the address." She hung up. She stood at the nursing station with her hand still on the receiver, and somewhere in the administrative wing of Cascade Ridge Medical Center, Patricia Sloan was compiling records that would reach the Oregon State Board of Nursing by the 8th, and in a JAG office in Portland, a major named Delphin had reopened an inquiry that Vale had believed was permanently closed, and in Seattle, a VA auditor was about to receive documentation of the conversation in which Preston Vale had offered to make an audit disappear in exchange for false testimony. The walls were closing in on him from 3 directions. He didn't know yet, but he would. And when he found out, when the inquiry reopened and the coercion evidence arrived and the corrected records from Cascade Ridge reached the board, the careful, patient structure he had built over 14 months was going to come down the way institutional structures came down when the foundation was built on the assumption that the person being targeted would not fight back. Not all at once, not cleanly, but completely. Lena pulled her jacket straight and went back to work. She worked her scheduled shifts on Wednesday and Thursday without telling anyone what was happening on Friday. Not because she was hiding it, the people who needed to know already knew, but because the hospital had patients who required attention regardless of what was unfolding in a JAG office in Portland, and the part of her that had spent 8 years learning to compartmentalize under conditions far worse than this was still functional. She did her work. She caught a medication timing error on a post-op patient in Bay 3. She talked a frightened 18-year-old through his first asthma attack without a family member present. She stayed 40 minutes past the end of her Thursday shift because a woman in her 60s had come in alone with chest pain that turned out to be a NSTEMI, a heart attack that announced itself quietly rather than dramatically, the kind that got missed when people weren't paying attention, and Lena had been paying attention. The cardiologist who came down was someone she hadn't worked with before, a younger attending named Dr. Lena Voss, who moved fast and asked good questions, and at the end looked at the initial chart and said, "Who flagged this?" "Voss," the tech said. "Night nurse." Dr. Voss looked across the bay. "Good catch." Lena was already halfway to the door. She drove to Portland on Friday morning in the gray pre-dawn, leaving Delmore at 5:30 to make the 2-hour drive in time for a 9 a.m. meeting she had not told Kessler about, because Kessler didn't need to be part of this, and involving him would have complicated it in ways that didn't benefit anyone. Hargrove was already there when she arrived at the JAG field office, a converted office building near the Federal District, anonymous-looking in the way that certain government facilities were anonymous, the exterior giving no indication of what happened inside. Hargrove was in civilian clothes, which meant she had made a choice about how to walk into this room, and the choice was intentional. She was a tall woman, late 50s, with close-cropped gray hair, and the posture of someone who had spent decades making decisions that other people had to live with. She looked at Lena when she came through the door and did not say anything for a moment, just looked, the way you look at someone you've been worried about and are relieved to see intact. "You look tired," she said. "I am tired," Lena said. "Good. Tired means you've been working." She put her hand briefly on Lena's arm. Not a hug, neither of them were that exactly, but contact, deliberate and specific. "Brierly is already inside. He's been here since 8. Lena nodded. "How is he?" "Scared," Hargrove said. "But he came." They went in. 1. Major Delphin was a compact, methodical man who wrote in longhand while people talked to him and typed later. He had a narrow face and reading glasses that he took on and off throughout the morning, and he had the quality of someone who had been doing a specific kind of work for long enough that he had stopped performing objectivity and simply embodied it. Not warm, not cold, just precise. Owen Brierly was sitting at the table when Lena walked in. He looked up at her. He was 36 and looked older, in the way that certain kinds of service-aged people, and not dramatically, not in the visible ways that made for good before and after comparisons, but in the eyes, in the set of the jaw, in the specific tiredness that came from carrying something you'd agreed to carry and had been carrying ever since. He stood when she came in. It wasn't a formal gesture, it was just what his body did. "Lena," he said. "Sit down, Owen," she said. Not unkindly. He sat. She sat across from him, and Hargrove took the chair at the end, and Delphin settled his papers and uncapped his pen and said, "Let's start from the beginning, not the Kaldar operation. Before that, I want to understand the full context of the unit's command structure and how Lieutenant Colonel Vale operated within it." They talked for 4 hours. Lena gave her account first, methodically, in the chronological sequence that she had organized in her mind during the drives and the sleepless segments of the past 2 nights. She described the supply discrepancies she had first noticed in month 3 of the deployment, the pattern of inconsistencies across controlled substance logs, the way she had documented it, quietly, over 6 weeks before submitting the report. She described the date she had submitted it and to whom. She described the change in Vale's behavior toward her in the weeks that followed. Nothing actionable, nothing she could have taken to anyone at the time, just the particular quality of being watched by someone who had a reason. Then she described Kaldar. The engagement had been complex and fast, the kind of situation where the sequence of events had to be reconstructed afterward because during them there was no time for sequence, only for the next immediate action. The physician assigned to the unit, Captain Roland Ames, had been struck by debris in the initial exchange. He had a severe concussion and had lost consciousness before they reached the soldier. Ames was alive and in Lena's care, and she was the only person in that vehicle with any surgical training. The soldier's name, she told Delphin, was Garrett Tolliver from Missoula, Montana. He had a daughter. She said that not to make the account sentimental. She said it because one of the ways institutional processes dehumanized the events they reviewed was by referring to human beings as cases, and Garrett Tolliver was not a case. He was a man who had a daughter, who had a father, because of what had been done in that vehicle. She described the needle decompression, the failure of the decompression to fully relieve the tension, the decision to proceed to thoracostomy, the 94 minutes until the medevac, the outcome. Delphin wrote through all of it. He asked 4 questions, all of them technical, none of them leading. He was building a record. Then Brierly gave his account. He told it differently from Lena, not in substance but in texture. He was less organized, more emotional, stopped and restarted twice. He described handing her the needle. He described holding the airway. He described the moment the soldier's saturation climbed and what that felt like in a vehicle in a forward operating zone when you had believed for several minutes that you were watching someone die. He described Vale's contact 6 weeks ago. He read from the texts on his phone, which Delphin photographed. The language was careful on Vale's end, calibrated to be deniable in isolation, explicit enough to be understood in context. A man who had done this before, or who had thought carefully about how to do it so that it couldn't be cleanly attributed. When Brierly finished, the room was quiet for a moment. Delphin took off his glasses. He looked at the table. The first inquiry closed because the inventory records from the deployment had been partially amended after the fact, he said. We knew that at the time. We couldn't prove who amended them. What the medic who came forward 2 weeks ago provided, the logs she retained, shows the original figures before amendment. He paused. The gap between the original and amended figures represents a pattern of diversion over a period of approximately 8 months. Lena looked at the table. 8 months. While she had been working beside him, while the soldiers in her care had been receiving inconsistent pain management, while she had been doing the quiet, careful work of noticing something was wrong and deciding what to do about it. The coercion evidence, Delphin continued, combined with the original logs and Sergeant Brierly's testimony, is sufficient to reinstate the inquiry at a formal level. That decision has already been made. He looked at Lena. What that means for your situation is that the board inquiry he filed against you will be reviewed in the context of the substantiated allegation of misconduct and coercion. The board has been notified that we are in active inquiry. He paused again. I expect the board hearing on the 14th will go differently than he anticipated. Hargrove, who had been silent for most of the 4 hours, said, What's the likely outcome for Vale? Delphin put his glasses back on. I'm not going to speculate about outcomes. I'm not asking you to speculate, Hargrove said. I'm asking what the range looks like. He looked at her for a moment. The range, he said carefully, includes court-martial. The room absorbed that. Lena looked at her hands on the table. She thought about what she felt specifically and found that it was not what she would have expected. Not satisfaction, not relief, not the clean resolution that the word justice was supposed to produce. It was more complicated than that. It was the feeling of something being corrected that should never have gone wrong in the first place, and that feeling had a weight to it that wasn't entirely comfortable. She had filed a report because patients were suffering. She had ended up here, in a federal office, reconstructing 4 hours of history to save her career, because a man had decided that the most efficient response to accountability was to destroy the person who had demanded it. That was the thing she would carry out of this room, not triumph. The reminder that doing the right thing didn't protect you from the cost of it. It just meant the cost was worth paying. She drove back to Delmore in the early afternoon. The board hearing on the 14th was not what Vale had built it to be. Lena drove to Portland again that morning, this time with the corrected Cascade Ridge employment record, Breck's documented assessment, a letter on hospital letterhead from Kessler that ran 3 full pages, the OR records from Margot's surgery, the incident chronology from the mass casualty event, and Delphin's written confirmation that a formal military inquiry had been reinstated and that the board inquiry filed by Vale was under review for evidentiary issues. She had a lawyer this time. Hargrove had insisted on it, and the lawyer, a woman named Declan, who specialized in military-adjacent licensure cases and who had an extremely precise relationship with sentiment, meaning she had none visible during work hours, had reviewed everything and said, in the car outside the board building, "This should have never gotten this far." "No," Lena said. "For what it's worth, I've seen cases like this go the other way, when they don't have what you have." "I know," Lena said. They went inside. The Oregon State Board of Nursing convened its hearing panels in a room that was designed to be formal without being intimidating. A long table, a panel of 5 members, a court reporter, visitors seating along the wall. Lena had been in rooms that were designed to be actually intimidating and knew the difference. This room was the institutional version of a throat clear before a difficult conversation. Vale was not present. He could not be compelled to appear at a nursing board hearing and had apparently chosen not to. His materials were there, the inquiry documentation, the witness statements. But Vale himself was in Portland, she'd been told, in a meeting with JAG counsel that had been arranged 2 days earlier when Delphin's formal reinstatement of the misconduct inquiry had been served. The 2 witnesses he'd named were technically present on paper. Brierley had submitted a retraction of his statement with attached documentation of the coercion. The other witness, a medic named Tasha Greer, who had been on the deployment and whose name in Hargrove's call had surprised Lena, had also submitted a revision, though Lena had not spoken to her and didn't know the full story there. It didn't matter now. What was in front of the board was a record that didn't resemble what Vale had filed. The hearing took 2.5 hours. The panel asked questions about the Kaldar incident. Declan answered most of them, framing Lena's actions within the scope of field emergency medicine and the specific circumstances of an incapacitated supervising physician. She cited the patient outcome. She cited the military's own records of the engagement. She cited Hargrove's written statement, the one Hargrove had drafted in retirement, with no institutional obligation to write it, because she had decided that not writing it was no longer something she was willing to do. Lena spoke when asked. She was factual and direct and did not perform humility or contrition for a decision that had been correct and that she would make again. At the end, the panel chair, a woman named Dr. Sylvia Vance, who had the specific directness of someone who had been running these hearings for a long time and had a low tolerance for institutional theater, looked at the documentation in front of her and then looked at Lena. "Ms. Voss," she said, "the inquiry as filed contains substantial evidentiary issues that this panel cannot overlook. We've received notification of an active federal misconduct inquiry into the filing party, and we have documentation suggesting the witness testimony was obtained under coercion. Given the totality of the record," she paused, "the panel has no basis to proceed with the original inquiry as filed. The matter is dismissed." Declan made a small note on her legal pad. Lena said, "Thank you." Not because she felt grateful to a system that had allowed this to reach a panel at all, but because the word filled the space appropriately, and she had learned, a long time ago, that not every feeling needed to be expressed in the room where it occurred. They walked out. In the lobby deck, Declan allowed herself one unprofessional moment. She exhaled sharply and said, "Good," with the emphasis of someone who had needed to say it. Then she straightened her jacket and became professional again. Hargrove was waiting outside on the steps. She looked at Lena's face when they came through the doors and didn't need to ask. "Dismissed," Lena said. Hargrove nodded once. She looked at the street for a moment. "He's not done yet," she said. The JAG process. That's going to take months. I know. It will be unpleasant. They'll want statements again. There may be a formal court-martial hearing. You'll have to go over it all again in a different room. I know, Lena said again. Are you ready for that? She thought about it honestly, because Hargrove deserved an honest answer and not a reflexive one. Not entirely, she said, but I'll be ready when it gets here. Hargrove looked at her. I should have done more at the time, she said. When you filed that report, I should have… You gave me the space to do it, Lena said. That was not nothing. Hargrove accepted that. Not easily, but she accepted it. They stood on the steps in the November cold, and the city moved around them in the indifferent way cities moved around individual people. And Lena thought about the drive back to Delmore and the shift she was working tomorrow morning and a 7-year-old girl in a pediatric ICU who was being weaned off a ventilator. Ruth, she said. She used the name deliberately because Hargrove had asked her to and she had not until now. Thank you. Hargrove looked at her without the military distance that was her default, without the layer of rank that had always existed between them. Just two people on steps in the cold. Go home, Lena, she said. She went home. Done. 3 weeks later, Vale was formally charged. The charges, announced through official JAG channels and picked up by the military affairs correspondent for a Portland newspaper, included diversion of controlled substances from a deployed surgical unit, falsification of official records, and obstruction of a federal investigation. A fourth charge, witness tampering, in connection with the coercion of Sergeant First Class Owen Brierly, was added 9 days after the initial filing when Brierly's documentation was formally entered into the evidentiary record. The newspaper ran a paragraph. The military affairs correspondent wrote clearly and without embellishment. Vale's name was in the third sentence. His rank was in the fourth. His current post was noted. There was no editorial flourish because the facts didn't require any. Lena read the article on her phone in the break room at Cascade Ridge at 6:15 in the morning, between a trauma intake and a medication round, drinking coffee that had gone slightly cold while she wasn't paying attention to it. She read it twice. Then she put her phone in her pocket and went back to work. The recognition, when it came sideways and in pieces, which was how Lena preferred most things. Breck requested a formal team meeting 2 weeks after the board hearing, not a performance review. He was specific about that, as though the word itself had become something he was careful around. A team meeting. The distinction mattered to him, and she led it. He stood in front of the assembled ER staff, attendings, residents, nurses, techs, and said, without preamble and without the particular brand of practiced sincerity that made institutional apologies feel like press releases. I've spent the last year working beside someone I consistently undervalued. I made decisions about her competence based on feedback I didn't verify and assumptions I didn't question, and those decisions were wrong. He paused. I want to say that in front of all of you because the culture that makes that kind of mistake possible is a group culture, and correcting it requires acknowledging it collectively. The room was quiet in the specific way rooms went quiet when something was being said that didn't have a scripted response. I also want to say, he continued, that the clinical standard she operates at is the standard I want this department to reach, and going forward, that's the standard I'm going to hold us to. He looked at Lena. She was standing near the supply cart because that was where she had been when the meeting started, and she hadn't moved. She didn't say anything. She gave him a small nod that meant she'd heard him, and it counted, and they could both move on now. He seemed to understand it that way because he moved on. The meeting ended. People dispersed. Petra Osman walked past Lena and said, without stopping, "About time." Terrence gave her a brief shoulder squeeze and kept walking. Aiden Torres lingered for a moment, looked like he was going to say something articulate, and then just said, "Yeah," which covered it adequately. Dolores, of course, said nothing until they were alone at the station, and then said, "You could have told me, at the beginning, what was happening." "I didn't know at the beginning," Lena said, "and when I did know, I needed to deal with it before I could talk about it." Dolores looked at her. "That's the most you've explained about yourself in 11 months. 12 now," Lena said. Dolores made a sound that was almost a laugh. "Fair enough." The morning Margot was discharged, her mother came to find Lena. Her name was Clarissa Wend, and she was a compact woman with dark circles under her eyes that had not been there before the night her daughter had been on a gurney with a pressure of 76 and falling. The circles were new, the kind that came from 2 weeks of sleeping in hospital chairs and waking at every sound and counting breaths. She would carry them for a while. That was just how that went. She found Lena at the nursing station and said her name. Lena looked up. Clarissa Wend did not have a speech prepared. She opened her mouth, and what came out was not organized. It was the disorganized gratitude of a person who had been near something unbearable and had been pulled back from it and had not yet fully processed either the falling or the rescue. "She keeps asking about the nurse," she said. "The one who was there at the beginning, before she went up to surgery." She stopped, steadied. "Margot wants to give you something." Margot was in the doorway of the corridor holding her mother's hand in a blue sweater and jeans that someone had brought from home, looking like a child who had been briefly and terrifyingly broken and was now approximately mended. Not perfectly, not with the specific, effortless wholeness of children who had not gone through what she'd been through, but functionally, recognizably, essentially herself. She was 7 years old and she had her mother's dark eyes, and she was holding a folded piece of paper. She held it out to Lena. Lena crouched down to take it. She unfolded it. It was a drawing in crayon, the kind of drawing that children made when they were drawing someone important, with the specific stylized quality of earnest representation. A woman in navy blue, brown hair pulled back, hands that were slightly too large because the hands were important. The child had known that even if she couldn't have said why. Above the figure, in the uneven printed letters of a 7-year-old's best handwriting, were 2 words: "My hero." Lena looked at the drawing for a long moment. She thought about what heroism actually was, not the version that involved recognition or applause or anyone witnessing it at all, but the practical, unglamorous, often exhausting version that involved showing up and paying attention and doing what needed to be done before anyone else in the room had figured out it needed doing. She thought about Gerald Okafor, who had survived an aortic aneurysm because she had changed direction in a hallway. About Mrs. Fournier, whose heart had stayed in rhythm because someone had run an EKG without waiting for permission. About Garrett Tolliver from Missoula, Montana, who had a daughter who had a father. None of those people had given her drawings. Most of them hadn't known her name. That had been fine. That had been the entire point. But this child was 7 years old and had made something with her hands while she was recovering, and that act, the specific deliberate act of a child deciding that someone deserved to be seen, was not nothing. It was in fact a great deal. "Thank you, Margot," Lena said. She said it like she meant it, because she did. Margot studied her with the serious evaluative look that small children gave to adults they were deciding about. Then she nodded once, satisfied, the way children were satisfied when the world behaved as they believed it should. Clarissa Wen put her hand over her mouth briefly. Then she took it down and straightened her own spine. "If there's anything," she started. "She's going to be fine," Lena said. She said it not as comfort, but as fact, which was how Clarissa needed to hear it. "Mabe and Spaulding are both excellent. She'll have follow-up for the vascular repair, and they'll watch her closely. But she's going to be fine." Clarissa nodded, took a breath. They left. Lena stood at the station and looked at the drawing for another moment. Then she folded it carefully and put it in her jacket pocket. Dolores was pretending to sort papers. Her eyes were slightly bright. "Don't," Lena said. "I'm not doing anything," Dolores said. "You're about to say something sentimental. I was going to ask if you'd restocked Bay 2. "I'll restock Bay 2, Lena said, and went to do it. 6 weeks after the board hearing, the JAG process entered its formal phase. Vale's attorney entered an initial plea. The military proceedings moved into the particular slow-grinding gear of institutional accountability, which was not fast and was not clean, but was, Delphin had told her, in a brief phone call that lasted 4 minutes, comprehensive. The diversion charges alone carried significant weight. The witness tampering charge, once fully documented, added to it in ways that were unlikely to be negotiated down substantially. His security clearance was suspended pending the outcome. His post was vacated. The consulting firm whose number had appeared in the Cascade Ridge HR call log was under a separate review. It was not the swift and satisfying public moment that stories sometimes depicted. It was the slow, visible unraveling of a man who had built his protection on the assumption that the people he targeted would not have the resources, the documentation, or the will to push back. He had miscalculated on all three. Brierly called her once during that period. A brief call, mid-morning, his voice steadier than it had been in the JAG office. "His sister okay?" Lena asked. "The audit was dropped," Brierly said. Once the connection to Vail was established, the auditor apparently had a conversation with his supervisors, and the thing went away very quickly. "Good." A pause. "Lena," he said, "I know what I did. I know that saying I'm sorry." "You came to Portland," she said, "with the texts. You told the truth." "I should have told it sooner." "Yes," she said, "but you told it." He was quiet for a moment. "You're going to keep doing this, aren't you? The nursing?" "Yes." "At Cascade Ridge?" "For now." She looked out the break room window at the parking lot. The mountains were visible today. One of those clear November days that made you remember they existed. "Kessler asked me to be involved in the trauma protocol review. He wants to revise the independent clinical judgment guidelines. They're putting you in charge of writing the rules you broke." "I didn't break the rules," she said. "The rules were wrong." He made a sound that might have been a laugh. "Yeah," he said. "Yeah, that sounds right." In December, Cascade Ridge Medical Center held a small internal recognition event. Not a ceremony, because Lena had told Kessler she would not attend a ceremony, but a department meeting with better coffee than usual and a letter of commendation that went into her personnel file and a brief acknowledgement from Dr. Hiroshi Mabe, who had driven in from the other side of the city on his day off to say publicly that the image read, "Lena had performed on a bedside ultrasound in a mass casualty event, had changed his surgical approach, and saved a child's life." Mabe was not a man who said things he didn't mean, because he didn't have the bandwidth to spend on it. The room understood that, and the room understood what the statement cost him and what it meant. Lena thanked him and moved on and spent the rest of the meeting arguing quietly with Breck about the new protocol language, which was a much better use of her time and which was also, she recognized, the thing she had wanted since the beginning. Not a letter in a file, but a seat at the table where decisions got made, where the rules could be shaped by someone who understood what happened when they were wrong. She got that. Not because it was given to her, but because she had stayed. Because she had done the work for 12 months in a hospital that didn't see her, and when the moment came that required her to be seen, she had not made herself small enough to disappear into it. That was the thing about quiet strength. The kind that didn't announce itself, didn't need the room to know it was there, kept doing the work regardless of who was watching. It was not passive. It was not meekness. It was the decision, made repeatedly, to let your actions be the argument and to trust that eventually the record spoke. The record had spoken. The protocol meeting ended. People left. The better-than-usual coffee was gone. The letter in her file would stay. She put on her jacket and walked to the PICU, not because she was scheduled there, but because she had heard from the charge nurse that a 12-year-old was having a rough night, post-surgical, scared, and his parents were stuck 2 hours away in a weather delay. She went in. She sat in the chair beside his bed. "Hey," she said. He looked at her. He had the pale, exhausted look of a kid who had been brave for as long as he could manage and was running out of brave. "Does it get better?" he asked. She thought about Gerald Okafor, walking out of this hospital on his own feet. Garrett Tolliver from Missoula, who had a daughter. A 7-year-old girl in a blue sweater holding a crayon drawing. "Yes," she said. Not as comfort, as fact. She stayed until he slept. Then she went back to the nursing station and picked up her next chart and started from the beginning, the way she always did. Medication list first, then history, then notes. Because that was the sequence that caught the most things. And missing things was not something she could afford to do, and never had been. And that was not a burden she carried. That was just who she was.